together as we initiate chaos theory guarantees that we'll play like lightning shots sounding like thunder. For every time in the face that it hits us, we're faster. Well, they should know by now. They see the world keeps trying to shake us. It only waits us. The pendulum swings. The pendulum swings. It's in a beautiful darkness. Only another. It's full steam ahead. Full steam ahead. All about the Petty Express. Misdirected from the start. It's a runaway train. I come a freight train. I come a freight train. In a beautiful darkness, the Petty Express. In a beautiful darkness.
Good morning, you guys. Just letting you know a bit how we're going to run things because I know we are pretty much getting ready to go into the. Okay, where am I? I was hearing me, which is disconcerting to hear my own voice in my head. So I had to. But I do want to give you guys a little bit of a roadmap as to how we're going to be handling yesterday afternoon. I will allow, us to get to the introduction of the medical examiner, but we are not going to engage in the emotional cruelty that the Commonwealth was perpetrating yesterday. I do have a rant. It does involve curse words. And then we're gonna move on and try to catch up with the actual what is the reddish brown on your bow? Well, so, I have been thoroughly grossed out, and normally, look, I let people be people and let, the marketplace, but, this is my beta model Snarks and Craft, bow. It's called Trauma Vulture or Trauma Tourist. It's, dedicated to certain creators who are mega interested in cases for personal clout and getting close to families, but, mainly for personal gain. So she has the eyebrows of journalism ink, the penny problem glasses, the eyes that see everything and nothing at all. The tickets, because this is a TV show to her, not like human tragedy or nothing. And then a mirror so she can look good, journalism ink. Um, and I am wearing my own personal cloak. Look, I have wanted a cloak my entire life. I have a hoodie right now. I will be getting a cloak at some point, but this is gonna be some god awful testimony, even if we zip through it. Even if you just got zips and bits of it, um, from yesterday from X. So and I have look, I have a couple things to say directly to Matt Walsh. Checks notes. You have been the channel that gets really pissed off at the left, strawmanning arguments, not knowing any facts and then bloviating about things, misrepresenting the base facts of issues and having a, not emotional, emotionally based argument and look at the facts at the table. And yet you decided to bloviate and speculate on the Lindsay Clancy case, which again checks my notes. It doesn't appear that you have ever actually covered in any extensive, manner, nor have you invited guests on your show to since you disbelieve the validity of postpartum mental health issues, then at least you haven't, again, checked my notes, brought in experts to refute anything, but you wanna go after Bob and Ali Mata from Defense Diaries for showcasing the human compassion that Kevin Reddington was showing his client, and again, checks my notes, claims to be Christian. Now, call me a little autistic, and I most likely am. But when I look around in this world, and I too am the world's worst Christian, I wear the label properly, uh, and I look around and I look at the world and I ask what the world what it needs, and I pray and I asked God, does the world need me judging? And I understand I just spent a long time making a snarky bow, but I never claimed to not be a hypocrite, Matt, whatever your name is. Lovely beard, though. Points for the beard. It's attached to a douchebag. What can I do? You have for years, in fact, made an entire channel platform on the fact that you felt that your side wasn't given a fair shake optically or in the media, and then you decide to bloviate about something that you have done exactly what you accuse the left of doing. You saw a story, you didn't research it beyond the topical, I'm guessing, and you had an emotional reaction. And your other great sin, in my opinion, as an intellectual, is that you refuse to understand the reality of two things being true at once. Because if you think that any one of us who are trying to call out the medical industrial complex or show even a modicum of human kindness to Lindsay Clancy are at all excusing the fact that those 3 innocent children are no longer on this earth, then I am confused, because haven't you been the one preaching that 2 things can be true at the same time since the nascent birth of your channel/platform? So again, I am just pointing out the obvious here, but as a Christian, I don't think I was called to, at this particular moment, to judge, because there's gonna be a whole hell of a lot of judgment. We live in a hell of a judgy, noisy, distracting world. What we have an acute lack of in this world right now, as a Christian, in my opinion, is humanity and compassion. So, for what it's worth, that's my opinion on what I saw displayed yesterday, and I would hope that this would be a learning experience for you, but I doubt it will be. But Allison and Bob, they held their own, but I just thought I would say a little something, something, since I found that with the cloak of, or even a semi-functional cloak, uh, my bravery is magnetized. I will use the cloak for goodness, I promise, most of the time. But I just found I had a couple of things to say. And I really don't like it when you claim to be an intellectual and you're calling out, these logical fallacies, and then you use every single one of them when it suits you on a topic you'd have no knowledge about.
Let's close back the session. Maybe see.
All right. We all set for the jury?
Yes.
All right, George Edward.
One quick detour too. We are at 1.25. I do have the closed captions up. This being a New England trial, if it's a little too fast, let me know. We can go back down to normal. But we were doing okay at 1.25 yesterday, so
This court's now in session. Please be seated.
Your Honor, for the purpose of the record, we return back to the trial, Commonwealth versus Lindsay Clancy. All parties are present, including the defendant and including the 18 jurors.
All right, counsel?
Thank you, Your Honor. Morning.
Good morning.
So can you tell me, is it 4 times that you yourself actually met with Lindsay or more?
Can you repeat that?
I'm sorry. Was it 4 times that you actually met with Lindsay or more? And that would include telehealth.
4.
4
Yes.
times, okay. You met with her on the 2nd of December, right?
Yes.
And you met with her on the 12th of December, is that right?
Yes.
You met with her on the 19th of December, right?
Yes.
And is it the 27th as well? Was there another one? Do you remember when that was?
That was by phone.
By phone. Would that be the 27th?
Yes.
Okay. So what I'm going to do is give you the documents that the district attorney is questioning you from, so that you can actually have in front of you, okay?
Thank you.
And you can slide up and just. And if I get confused or something, just let me know that you're on a different page than me.
I love that. The subtle petty there, and I am here to point out subtle petty because I am a fan. I am a sommelier of Schadenfreude, if you will. And the subtle petty of Reddington being the one to provide documents when the Commonwealth has been up his butt and around the corner about he didn't give the witness the documents. If he would only give the witness the documents. And he's like, allow me, madame, to give you the documents the Commonwealth left you bereft of. And he makes like a grand gesture. He walks out. I love it. I love it, Reddington. I love it.
Couple of background questions. When you met with Lindsay, for example, on the 2nd of December, you were at least able to look at the
It's
records
Mutimus.
of Nurse Paul as well as Nurse Gelada, right?
No.
Oh, you guys work in the same place though, right?
Yes.
Okay. So when a woman is in postpartum and comes to social health for help, when you're trying to help them, you can't see the medical records from what the other people like Nurse Paul and Nurse Gelada have written down?
You can see the records. Yes.
You can?
Yes.
Okay. So you did look at the records?
I did not look at the records.
Okay. On the 2nd of December, and you can look along with it if you wish.
Okay. Not to call out the obvious, but how is this supposed to be holistic, team-based care if you don't look at the other provider's records when you're in the team to give holistic, team-based care?
Looking under what would be referred to as behavioral health intake. Your pages are numbered, mine are not. So if you can find that one page, behavioral health intake on December 2nd. And the jurors will have this as an exhibit, but just going through the pages. You have it?
1 second. Yes, I have it.
Okay. Now, one of the things that you would be interested in when you're interacting with a patient that comes to your facility for help is how honest they are, right?
Yes.
Especially in psychiatry. You want to make sure that the person is not lying to you or hiding something. You want them to be honest, right?
Yes.
And for example, Lindsay disclosed to you and to the others that back in 2012, while she was in nursing school, she actually had Prozac because she was very nervous actually about public speaking, but she was on Prozac, right?
1 second.
Sure. I think it's right under behavioral health history, first paragraph.
Yes. Yes.
Okay. And she also told you that she had been prescribed Ativan, for example.
Well, yes, we are behind. I got stormed out, and thankfully, well, that's actually why we're starting a bit early too, since we're behind. Uh, I think maybe the universe was letting me go to Hobby Lobby and have fun and not be subjected to this because there is going to be a medical examiner. We are not going to stay there. We are not even going to really play it. I am going to have a rant, but basically Lindsay broke down, as one would imagine, as anyone with any sort of modicum of human grace would understand, that the in-depth talk about how one of her children passed away would have been devastating. So we're not going to stay there. And I don't even see the logic in it. If the Commonwealth were getting anything except from oh, and thank you so much, Charlotte. Yeah, those first videos were like hostage videos, but it's always fun to go back and see how far you've come. And I still feel like I'm learning so much. So it's nice to be one step up from a newbie into a novice. It is kind of nice. Um, So all that being said, I don't understand what the Commonwealth hopes to achieve by this. If it were strategic, I could understand the crass use of emotion. If it were getting them the support and if public support was with them, if the general consensus was that they were doing, a distasteful but necessary job for justice, then I could understand crassly using these emotions. But they are legitimately the most disliked people on the face of the planet right now, according to my algorithm, which is by all means skewed. So I don't get what they're getting from this other than malicious torture, and it's reading that way to everyone. So I don't get this. I would have thought that at some point their higher ups would have come to them and said, "You guys are this is bad. This is bad. Change your tactic. You're probably not going to be able to salvage an actual guilty on the top charge, but maybe we can get reckless, change your tactic, do something. We are looking incompetent." But no, it is that dogged just death grip on this terrible idea, these terrible optics that baffles me. I legitimately I can make no sense of it, and I can usually make sense of illogical things. Humans working against themselves, saying one thing and doing the exact opposite. It doesn't logic to me, but I can empathize or at least understand why it is done. For this, I have no logical payoff other than the malicious torturing of Lindsay. A- a- And I would hope that that is not the only payoff, but it is becoming more and more apparent that there are no other options as to why they continue to treat the case this way.
By psychiatrist Jennifer Tufts, right?
Just reviewing.
Second paragraph.
And Samantha Shoelover, I think, is correct because I almost didn't cover this because I thought I would essentially become, for all effects, the Commonwealth. I would have absolutely no humanity, no shred of grace for her, nothing. I would be a stone. And then I started reading and I started researching because several of you guys had asked me to cover this. And I figured, okay, I had actively avoided this on the fear that I wouldn't be able to get past the horror of it all. But this is just insane. I have never seen a trial this awful. And thank you, Free the First Amendment. Uh, take care of yourself. Like I said, we do have puppy kitten breaks. We do have, uh, breaks and everything, but be mindful of yourself. If you can't watch today, if you need to take a break, please do that. And on another note, be mindful of your weather situation. Uh, the Midwest is still in a kind of an iffy weather pattern that we're still expecting rain and a lot of places are flooded. So don't drive through standing water. Be mindful of your weather situation and just, keep an eye out and reach out and touch base with people who may not have basements or may live in low-lying areas. See if they need help or if there's general places where you guys need to go. Uh, don't get so sucked into the trial that, oh my goodness, everywhere is flooding. Do be mindful of it.
So, no, that's not what I see here.
Okay, do you see where it says prior to attending the SHORE program, sentence, second paragraph?
Yes.
Patient was prescribed Ativan by psychiatrist Jennifer Tufts?
It says here she was prescribed Zoloft.
Well, I must be misreading something. I apologize. Let me approach you. This is what I have here. History and current functioning, right? History and current, okay. And then behavioral health history, paragraph 1, right? References to Prozac, right?
Yes.
Okay.
But it doesn't say. You
Second
said Dr. Tufts.
No, I was saying the second paragraph, prior to attending SHORE program, she disclosed to you that she was prescribed Ativan, right?
So which one are you on?
Second paragraph, right here.
Okay.
Yeah. Prior to attending SHORE program, patient was prescribed Ativan, right?
Yes.
Okay, and that was by Dr. Tufts, right?
Yes.
So she told you that she was prescribed benzodiazepine by her treating psychiatrist, and further on into your interaction with her, she told you that she was very concerned about taking medication, right?
Yes.
And she was really concerned about becoming addicted to medication, such as a benzo, like Ativan, right?
She was concerned about becoming addicted to medication. Yes.
All right, and the very last paragraph says, when no longer taking Ativan. You see that one?
Yes.
Okay, she then explained that she had issues with the sleep, and she started having heart palpitations, and she went to the ER for anxiety. Is that right?
Correct.
And at that time, she told you that she felt that she had an addiction to Ativan. That's why she couldn't sleep, right?
Yes.
And she was stressing about that, was really concerned about that, right?
Yes.
She then said that she had weight loss, right?
Yes.
No appetite, right?
Correct.
Panic attacks, right?
Right.
Couldn't sleep, right?
Yes.
Next page, December 2nd, office visit, same visit. First paragraph, she was prescribed Remeron and Seroquel in the past 4 days, right?
I'm sorry, this is a different date on this one. What date do you have?
Okay. So the next page.
Mine goes to 12/5.
Okay, all right, let's look at this one then. Would you agree that this is a record from Social Health that talks about continuing your appointment December 2nd?
Yes.
Okay. If you can
I
find
think
it.
they were just out of order.
Okay,
Okay.
that's fine, that's no problem. That's not your fault. So are you with me on that she was prescribed Remeron and Seroquel?
Yes.
Okay.
Samantha Shoelover, I believe in this particular setting, maybe I'm misunderstanding, but I thought holistic means no drugs by natural remedies. These people seem to want to push every pill. I think holistic in this particular setting means the patient as a whole. And for that, they're more talking about they have a psychiatrist who can deal with sort of the medical brain chemistry part of postpartum. They have the licensed mental health counselor, this woman on the stand that can talk about the behavioral cognitive sort of side of it, and possibly a substance abuse counselor if there was worry about dependency issues, because I think it was kind of in conjunction or in league with a substance abuse clinic, outpatient one maybe. So I think in this particular case, and I do think there is sort of a sleight of hand where holistic in medical settings can sometimes mean that there is a more naturopath or sort of looking at the body chemistry and how to naturally reset those with the least amount of medical intervention, and then holistic, which I think in this particular setting just meant that they had different options available to kind of be a multidisciplinary team to look at uh, postpartum. But there is sort of a sleight of hand because I think you do have to look at more naturopaths or doctors of osteopath. Uh, if you would like to go maybe the more natural or holistic in that sense, kind of medical route. And I think there is kind of a disconnect on how patients perceive what these words mean. So I'm not saying that it's a legitimate marketing, deception per se, but there is a disconnect, whether rightly or wrongly, about how patients perceive what these words mean and what they actually mean in the reality of a clinical setting.
It was within the last 4 days. Is that right?
Yes.
So when you saw her on December 2nd, after telling you about the Ativan and telling you about her weight loss and her anxiety and everything else, she told you that she had been prescribed Remeron and Seroquel. And I understand you don't do the drugs, so you don't really have.
No, I don't do
Very
medication.
difficult to get the brand names and the other names, but we have a chat for that. So she started Remeron and Seroquel, and then she told you that since starting the medication, she's had thoughts that she no longer wants to be here, meaning, I guess, what, on the earth?
No longer
Wanna
wanting
kill
to be
herself?
here could mean anything. But in that instance, when assessing,
It could mean anything. Why are we putting down euphemisms? You are not a YouTuber. You don't have to euphemism self-delete. You can actually use the words because we need to use the words. I hate to go full George Carlin, but had we kept PTSD as shell shock, as a shock to the system, if we had kept it as the literal bomb that it mentally feels like when you have it, would we have lost so many soldiers? Oh my goodness gracious. Jesus wept.
For suicidal ideation, no longer want to be here, qualifies as passive suicidal ideation.
Okay. And then she indicates further that this week, she was seeing you, feels like she's going to die. That's what the DA read to you, right?
Yes.
But then it goes on and says, but she doesn't care if she dies, basically. She feels like she's going to die, but she doesn't care. She said that, right?
Yes.
She then talked about how the Remeron and Seroquel were not helping her sleep. Yesterday, she took Ativan, she told you, right?
Yes.
Due to intrusive SI, suicidal ideation thoughts, right?
Yes.
Did she indicate what the intrusive suicidal ideation thoughts were yesterday, which would be December 1st? Did she tell you what that meant? Did you ask her what she meant by that?
I did ask her what she meant, and that would mean that she had the thoughts that she told me about no longer wanting to be here.
Okay. And you then told her that she could go to the ER and that you then sent her local crisis contact information. Is that right?
Yes.
And then talks about onset. Says 3 months after the baby was born, she had unmanageable anxiety, correct?
Correct.
And what did she tell you the anxiety was about?
1 second.
Yep. It's under onset.
In case you're wondering, these would be what we call red flags. Now, for some odd reason, there was no red in the 2 packs of pendants that were on clearance. So this is a purple flag. But still, passive, whatever, any ideations of this sort should not be, well, up to interpretation. They are cries for help. To get to a point where you don't care whether you are on this planet or not is a terrifying, horrible, lonely, isolating place to be. And thankfully, I haven't been there very often, and I've had people that have been shining lights for me and holding them out and lighting up that dark time, for me. But here is a woman who it's her job to be a professional light holder, and she's like, "Well, it's up to interpretation." I have to cipher these things out. No.
And what was the question?
Under onset, she indicated 3 months after the baby was born, she had unmanageable anxiety. Is what
Yes.
the district attorney asked you. And then it continued on with a sentence. What was her anxiety about?
About her children, especially the baby.
And what does that mean? That she was having unmanageable anxiety? What does unmanageable mean?
So constantly worried that something was going to happen to her children or something bad was going to happen to the baby.
And at that time, the children were 4, 3, and 6 months, right?
Correct.
Under social, the notes indicate that she talks about her anxiety all the time with her mom, husband, and mother-in-law, correct?
Correct.
And one of the questions the DA asked you is about her support, family supports or collateral contacts, and you indicated the mother-in-law. She also had her mother and father as family support as well, right?
Correct.
And you knew that her mother and father had actually lived in Connecticut, but moved up or came up and stayed with her for at least a week, if not longer, during December, right? If you know. And I know it's difficult if it's not in the notes for you to remember. I'm just asking, do you remember it all that she said that her mother and father came up and stayed with her to help out?
I don't remember that.
Okay. She further went on and said that she's uninterested in other topics from.
Notice that subtle dig there. As a more behavioral part of the clinical care team in this facility, her notes should be very much full of these details. She is the one that the psychiatrist should be looking at to get more of the observational, baseline. She says she's really good at saying she's okay, but her affect is flat. She tends to fiddle with her fingers, not noticing, she's kind of the front line that's supposed to be there, adding the details, adding the insight, for the clinician who doesn't have as much time. And the fact that she didn't write these things down and him pointing that out is still a subtle dig at her documentation and how lax, how little it was, especially with in mental health. Again, going back to my own history, when I was to document observations, I had to be very detailed. I couldn't just say, patient, looked sad. I had to then say what I did to interact with the patient and, further investigate. And then if there was any concern there, I had to document that and let the practitioner know, the clinician who actually, I was documenting under. So this is in no way how this is supposed to go, even with my limited understanding of medical documentation.
Friends, what did that mean? She just didn't want to talk to her friends about anything?
She just had a lack of interest in conversation with friends.
And that would be her social circle. She just didn't care, right?
Right.
She said that she felt numb, right?
Yes.
She had a lack of attention, right?
Right.
Confusion, right?
Right.
Under mood, it says, well, of course, you have disturbed sleep. She's only sleeping 2 to 4 hours a night is what she told you, right?
Correct.
And then it says supports. Mother and father had been staying with her for the past week. Does that refresh your memory that you did get that info, that they were staying with her for the past week?
Yes.
That's fine. I just saw that too, so no
Yes.
problem. You took her history, that she was a nurse, that she had been on leave, and she told you that she lost 10 pounds in the past month, right?
Correct.
Now, can you flip to the next page and make sure we're both on the same page? On the substance use assessment, do you have that?
1 second.
Yep.
Yes.
Okay. So one of the things that you're concerned about is whether or not your patient has a substance abuse problem, like drugs or alcohol or something like that, right?
Correct.
And you've already told us that your opinion was that Lindsay did not have any substance abuse problems other than her fear about the prescribed Ativan, right?
Correct.
So did you ask her about alcohol?
Yes.
Can you tell me what she said about alcohol?
She said the last time she drank alcohol was in October of 2019.
Go ahead.
Yeah.
Did she tell you how much, what it is that her alcohol of choice was?
She said her alcohol of choice was wine. She would have 1 to 2 glasses.
Did she say why she would do that?
To cope with anxiety.
Okay. And this is back in 2019, right?
Correct.
That would be 3 years before you actually met with her in December of 22, right?
Correct.
Cannabis, the
Yes.
weed, the devil's lettuce. How about that?
Oh my God. My heart just grew 17,000 gajillion times. The devil's lettuce. Kevin Bredington, just when I thought that my fandom of you was getting weird, you just go and make it weirder. Like I am such a fan. Like I'm not gonna bother you on the street or nothing or send you like weird anything, but like I just love you. Thank you so much, Idol.
Did she confess that she was using marijuana?
Yes, she said she did use marijuana.
When?
Last use was November 15th, 2022.
Why?
I'm sorry?
Why did she say that she used it? It's under comments?
Yes, I'm taking it.
That's okay.
She said she tried a marijuana gummy to help with sleep.
And that was on November 15th of 22, right?
Yes.
Go to the next page, assessment and recommendation. If you have that, make sure we have it.
Let's see. Yes.
Okay. And I think the district attorney had asked you about the mental status exam facial expression, and you indicated that her facial expression showed anxiety, right?
Correct.
Fear, right? Do you know what the fear was?
Just going back to that part of the
Sure,
assessment.
yep. It's under facial expression.
And you said facial expressions,
Yes,
right?
please. Yeah.
Anxiety, fear, apprehension, sadness.
Okay, so if I can, I apologize. If you just keep you're very soft-spoken.
Yes, I'll walk.
Voice up so the jurors can hear you.
Yeah.
Thank you. And you said that her facial expression exported to you anxiety, right?
Correct.
Fear of something, right?
Yes.
Apprehension, right?
Yes.
Sadness,
Yes.
depression.
Yes.
And she expressed that she was having anxiety and numbness, right?
Yes.
And she was crying when she was telling you this, right?
Yes.
And again, indicated that her thoughts were worried about her baby, the new baby she had, the infant, as well as if she's being addicted to Ativan, is what she told you, right?
Yes.
And again, thoughts of wanting to die, but there was no plan.
Correct.
Next page, risk assessment. There's a whole lot of stuff on these pages. I'm just trying to cut to the chase here. So you see where it says risk assessment?
I am trying to find
Okay.
it. 1 second.
Yep. It's under a current it's under a risk assessment.
I'm taking a look.
Okay.
I see protective factors, but I don't see risk assessment.
Okay, let me ask you, under risk assessment on December 2nd, when you asked me about that, at that point, that she, just so you can see, she again admitted to suicidal ideation, right?
Yes.
It was passive.
Yes.
She says she wants to go to ER if she feels unsafe or has a plan, right?
Yes.
And then farther down, you have current medications, and she was on quetiapine or Seroquel, right?
Yes.
Fluoxetine or Prozac, right?
Correct.
Lorazepam or Ativan, right?
Yes.
Mirtazapine or Remeron, right?
Yes.
They were all, that was all active prescriptions that she had on December 2nd, right?
Yes.
Told you that she is seeking counseling for postpartum anxiety, right?
Yes.
Do you have on December 2nd, continuing on with your evaluation, where it says clinical notes? Do you have the clinical notes?
1 second.
What I could do is read what I have rather than stand next to you. And if you trust me that I'm not misrepresenting it, I mean, I'm just reading off of this to make it quicker for you. If
Okay.
it refreshes your memory. If it doesn't, I can walk up and show it to you, okay?
Okay.
On that day, your notes say patient requested addiction support services. Do you recall that?
Yes.
And that you indicated that you would be sending patient addiction support resources by my chart, or the message thing, right?
Correct.
You then indicate that based on history reported, patient meets the criteria for postpartum anxiety, right?
Yes.
That she would benefit from OP therapy. What does that mean?
Yes. From outpatient therapy services.
PHP,
Yes. Partial hospitalization program.
IOP,
Intensive outpatient program.
and that you then helped her out by bridging the therapy services, right?
Yes.
You then noted again postpartum anxiety on December 2nd, according to your notes, right?
Yes.
Okay. Now, did you know that she had been seeking and receiving therapy? I don't know if it's therapy or counseling or that type of thing. Like there's a woman that works in your business that provides therapy, right?
Yeah. So that person would be me.
So did she come to see you for therapy?
Yes.
Oh God. Oh God. The burn. The burn. Oh. Oh, does anyone have any aloe? Does anyone have any aloe? Good God. That was savage. Like, my social anxiety has social anxiety after that comment. Oh. I have to see that again. Oh my God, Reddington, you're my hero.
Therapy or counseling or that type of thing. Like there's a woman that works in your business that provides therapy, right?
Yeah. So that person would be me.
So did she?
Oh, someone call the ambulance. That one hit home. That one hit. Ow. He sunk my ego battleship.
Come to see you for therapy?
Yes.
How many times?
4.
So is it fair to say that she was more than willing to accept help from somebody like you?
Yes.
She didn't appear to be avoiding any therapy when recommended, right? If you could, Ms. Dukes, please look at, I think it was December 12th was the next time perhaps that you saw her?
Okay.
Unless it's, there's another intervening period.
So there's December 12th and then there's December 5th.
Oh, okay. So if you could pull out December 5th,
Yes.
and if I can come up and look at it.
Yep.
All right. So on December 5th, again, you were meeting with her for therapeutic intervention, right?
Yes.
And that on this occasion, she reported she had a difficult weekend, right?
Yes.
Intrusive thoughts of wanting to die, right?
Yes.
That she contacted Aspire Crisis Support, right?
Yes.
She met with an Aspire clinician, right?
Yes.
And what happened when she met with the Aspire clinician?
She met with the clinician virtually and was told that she did not meet the criteria for inpatient treatment due to not having any suicidal ideation plan.
So if she said, in addition to the fact that she's been in counseling and therapy and seeing psychiatrists and on medications for the past 3 months or whatever the period ultimately would be, and that she wanted to kill herself, didn't want to be here, couldn't care if she died, they told her because she didn't have a plan that they couldn't help her?
Correct.
Did they, to your knowledge, make any recommendations? Did they recommended that she attend a day program?
Yes.
All right. And that person from Aspire then said he would send her patient resources, right?
Correct.
But nothing ever happened. He never sent her any. You did, but he never sent her any patient resources, right? If you know.
Not to my knowledge.
Okay. All right. So she had you at least to talk to and counsel and advise her. You continued on to make your observations.
Actually, I was thinking of for those of you who don't know, because you weren't really enamored with Silence of the Lambs, but Anthony Hopkins actually he writes music. He's very humble about it. But if you ever want to see something really cute, like in the genre of like cute old man being humble, embarrassed at the same time. I don't remember where I came across it on YouTube, but a symphony playing one of Anthony Hopkins' original compositions, uh, and then Whitney Houston. So the musical combination right now in my head is Anthony Hopkins orchestrating Whitney Houston, which is not Ebony and Ivory, but along that genre. So there you go. I didn't go normal with it because he reminds me of Anthony Hopkins, whom I not for Hannibal Lecter, but as a person, I admire.
Say that pretty much things stayed the same as far as her appearance, appearing anxious, appearing sad, unable to relate to people, that type of thing.
Correct.
Then you have is a chief complaint of present illness. And again, that was, oh, wait a minute.
That's not my note.
That's not you. Okay. All right, so you can hold on to that.
Yep. Thank you.
Next time you saw her would be December 12th. Is that correct?
Correct.
All right. Now, on December 12th, that was a teleconference that she had called by an appointment with you?
Yes.
And at that point, she reported that she had a difficult weekend and was experiencing intrusive thoughts of wanting to. Do you have it in front of you? I don't want to take advantage of it.
Hold on one second.
Yep.
I don't see the 12th in here.
Okay. Page 28.
Page 28.
And just for the record, I think, Your Honor, that she's looking at the actual exhibit. Am I right? That's the exhibit? That's in evidence? No, it's not. Okay. Can it be in evidence? Can I offer that? Yeah. Okay. Can I offer that?
Any objection? Sure. Yeah. Yeah, if I could just get that.
All right.
Yeah,
Did.
it references, um, do you have December 12th? Again, I could do what I did
She
before.
probably had it before.
Right, yeah.
Did.
It references providers' interventions, and that would that be you, provider?
Correct.
Okay. And you're talking about symptom management, and yet again, she's reporting she had a difficult weekend, experienced intrusive thoughts, wanted to die, didn't have a plan for suicidal plan, but she contacted Crisis over the weekend, and that would be, again, Aspire, apparently, right? Because there were
Right.
2 times she contacted Aspire, not once.
Correct.
Twice. Both times they told her that there's nothing they could do for her, right?
Correct.
And she told you that she was going to start a PHP in Norwell on December 20th, right?
Correct.
But in fact, you were able to, knowing people that you may have and pull strings, you were able to try to get her into the Rhode Island Women and Infants program, right?
Correct.
Which is a really pretty good program.
Correct.
And did you know that she did, in fact, go to Women and Infants on December 20th? She didn't go to the Norwell program. She went to Women and Infants program, and that she was there for the day and that they basically turned her away.
I did know that she went to the Women and Infants program. I was not sure of the date.
Okay. So if I suggest to you it was the same date that she had told you that she was going to go to the program in Norwell on December 20th, and then that you and Nicole Harden Francis reviewed various options, one of which was that, which made sense, to attend the Women and Infants program, IOP or PHP program, right?
Correct.
And that she, patient, provided you with verbal consent
Correct.
to sign whatever had to be signed and get her into that program, right?
Correct.
So you know that she did on December 20th, after not getting anywhere with Aspire ×2, and after dealing with Gelada for all those times that she dealt with, the other one, Tufts, you were trying to get her into this program, which would be pretty good for a woman that had postpartum problems, right?
Correct.
And you made your referral, you opened the door for her, and she got in there to at least be interviewed, right?
Correct.
And they didn't take her, right?
Correct.
You know why?
I am not aware as to why.
Would you be surprised if I told you that they indicated that they could not help her out because their diagnosis or secondary diagnosis was that she was over-medicated?
Repeat the question.
Would it surprise you to know that they indicated that they couldn't treat her as a woman with postpartum psychosis or postpartum depression or postpartum anxiety or any of that because their opinion was that she was suffering from an over-medication?
It would surprise me, yes.
But you don't know.
I do not know.
Okay. Did you know that the records from Women and Infants indicate that, in fact, on that very same day, they reached out to Nurse Gelada and asked her to call them so that they could discuss the medication, and Gelada never got back to her?
I was not aware of that.
I'm sorry?
I was not aware of that.
Okay. I think the district attorney had asked you a question about the last time that you saw her or had any activity with her was on December 19th. Is that right?
Correct.
Okay. And I may have misunderstood. Did she ask you, did you call Lindsay 4 times and she never got back to you that day? Or is that just a list of different things that you did for her?
That's a list of different things that I did for her that day.
Okay. So you were calling other contacts. You were talking to Patrick. You would contact her. I mean, she certainly was not avoiding you. That's
Yes, we were in communication.
all right.
And I very much like how Reddington is able to reframe the things that the Commonwealth has shaded as Lindsay avoiding responsibility or things like that, as what they really are. She was contacting other people on behalf of Lindsay, or she was gathering information. Lindsay wasn't avoiding her. She wasn't being a non-compliant patient. And it's bringing forward little details like this with every single witness that was in charge of Lindsay's care, that she was compliant, that she was forthright, that she maintained communications. It they are little things that he points out with each clinician, and I find it to be very important because it reframes the stupid narrative that the Commonwealth has been trying to push. And now another call.
You're familiar with, maybe you are, the what's called the Edinburgh scale?
I'm aware of it, yes.
And did she have the Edinburgh scale administered to her, to your knowledge?
To my knowledge, no.
Okay. What is polypharmacy? What does that mean?
Polypharmacy?
Yeah. You ever heard of that? Polypharmacy?
I've heard of it, but not sure of the exact
Okay.
definition.
Okay. Is it something to do with having too much medications thrown at you all at once? If you know.
No, I'm not sure.
Not sure. Okay. Excuse me for 1 minute.
I love that he's using his own television. I think, look, as the spokesperson for the weird part of the court of public opinion, speaking for the weirdos, the spazzes, the crazies, all of us who would rather wear a cloak and not deal with the real world, they are no longer laptops, they are television. They are no longer laptops, they are mini portable televisions, and you cannot change my mind. Reddington, you rule. I just love that he's using his own television.
Apologize. I just had something pulled up and it just went back to default on me. So I just need a second. I apologize.
Damn television on the fritz again.
Okay, I get it. And how long have you been working in your particular field?
Since 2011.
Okay. And you have obviously a very impressive background as far as your educational background and your experience. Do you continue to, like, with continuing education?
Yes.
Have you ever been aware, are you aware of the Mass General Hospital Center for Women's Mental Health?
Ma'am, it sounds, I want to warn you, this sounds like he's complimenting you, but in full Admiral Akbar fashion, it's a tarp, it's a trap. Whenever Reddington, when you are on the witness stand against Reddington and he starts praising you, it is a trap. I don't think she's aware of this yet, but I am.
Health?
I'm aware of it, yes.
Do they offer seminars and programs as well as research articles?
I believe they do.
Okay. Do you know that Mass General Center for Women's Mental Health about a year ago issued a fairly major study and various recommendations for people that are dealing with women that have postpartum periods and how they break up the periods? You familiar with that?
No, I'm not familiar with that.
So if I suggest to you that in that particular Mass General Hospital article, it goes on about postpartum period, and do you agree that the postpartum period, 85% of women that are pregnant or after pregnancy experience some type of mood disturbance? Would you agree with that?
No, I wouldn't agree with that.
All right. Would you agree that 10 to 15% of women develop more significant symptoms of depression or anxiety?
I agree.
Okay. And then postpartum psychiatric illness is then divided into three categories. One sounds like something out of the 50s, postpartum blues. Would you agree with that?
Yes.
You've heard that expression before,
Correct.
right? And it can be bothersome, it can be aggravating, it can be intrusive, but it's not threatening the life of the mother or a baby or anybody else, right?
Correct.
And it's fairly common, right?
Correct.
Number two would be postpartum depression. Now, that's a different issue, correct?
Yes.
And number three would be postpartum psychosis. Is that right?
Yes.
All right. Now, postpartum.
Hey, Joe, my stepsister unalived herself. She was bipolar. Doctor overprescribed meds. Family never sued and should have. I feel for this defendant. I'm so sorry that your family and your stepsister had to walk through that. And I'm glad that this is a place where when you can come watch the trial. I was shocked at the feelings that this trial brought out in me, and I don't mean that selfishly, but if you've ever been mistreated by the medical industrial complex or lost a loved one or seen a loved one suffer unheard, despite asking and begging for help. This has been a really rough trial, so I am so, so sorry, and I hope that, you know, it we can be a place you can watch this trial when you want to, but also there is, weekly wrap up and places and we can also just hang out and have fun. Joy is needed in our life. We see so much dark, so if you can't hang out for this trial, I completely get it, and hopefully you can hang out for a weekly roundup with Shizzy and Volstorm and have some fun.
Depression prior to morphing, if you will, into postpartum psychosis consists of a number of symptoms, symptomology, right? For you to diagnose a woman, whether she's pregnant, has a baby, or after having the baby, with postpartum depression, there are certain things that are symptoms that you look for, right?
Correct.
Okay. One of which would be depressed or sad mood, right?
Yes.
Lindsay had that, right?
Yes.
Next would be tearfulness, right?
Yes.
Lindsay had that, right?
Correct.
Next one would be loss of interest in social activities or usual activities or friends. She had that, right?
Correct.
Feelings of guilt. She had that, right?
She didn't express feelings of guilt.
Okay. Feelings of worthlessness. Did she express that she felt worthless?
She did not express that.
How about fatigue? Did she have that?
She did not express fatigue, but lack of sleep.
I know, lack of sleep. Were you aware that, in fact, that she had indicated that she was so wiped out that she couldn't even get out of bed, couldn't put her feet on the ground, and if she did, she felt heavy?
I did not hear that from her.
Okay. How about, you mentioned it, you got it, sleep disturbance is another issue, correct?
Correct.
She had that, right?
Yes.
Change in appetite. She had that, lost 10, 15 pounds, right?
Yes.
Poor concentration. She had that, right? She said she was numb. She could not focus. Suicidal thoughts.
Yes.
We know she didn't have a plan, but she had suicidal thoughts, right?
Correct.
So under the Mass General Hospital research project for women that are suffering from postpartum issues, she pretty much hit every one of the postpartum depression symptoms, correct?
Correct.
And then it talks about if it increases in severity, significant anxiety symptoms may occur.
Oh, R.J. Wright, the novelist, I have been shocked at the depth of feeling I have on this. And look, people might find it irritating that I'm wearing a bow of mockery to mock the Commonwealth, but I also find the trauma vulture YouTubers to be just as annoying. So, what has been cathartic about this trial is making bows of mockery. I've called it the line of the bows of our discontent. So this is one completely dedicated to not only Jess Machado, my favorite unintentional comedian, but Hidden True Crime, or that other chick with the crazy eyebrows, because we have the Journalism Inc. jackets, the eyes that see nothing and everything, the eyebrows of justice and Journalism Inc. Their admittance to the party or the show because they don't realize that this is human tragedy, and a mirror to make sure they look good doing it. For some reason, this has been the cathartic way that my ridiculous brain has decided to deal with the emotions of this trial. So she is what I call the trauma tourist. Uh, and I am having a blast with the bows of our discontent. To be honest, this trial has been unexpectedly emotional and draining, and it should be. This is a giant human tragedy, and I don't mind covering hard trials. But what I do mind is when other content creators that normally, look, I don't care what you do, you're not paying my bills, I just don't watch you. But when you, in the name of content creation for YouTube, and Journalism Inc., go out to be a dumpster fire human that doesn't understand that this is not entertainment, that this is human tragedy. This is sitting in someone's personal hell and trying to report on it with respect. And I get it. I am wearing a semi-functional hoodie cloak right now. But what you will never see me do is denigrate the victims or treat this as anything less at the end of the day than a human tragedy that we should all, reflect on. If we use dark humor or gentle mockery to, as our emotional support crutches, that's just what we do.
Not generalized anxiety. Significant anxiety symptoms can occur. Is that right?
Correct.
And one of the ways that you determine that is by the test that it can be administered to a person who is in a postpartum status. And that would be what we talked about, the Edinburgh test, right?
Correct.
And you're aware that she was given the Edinburgh test and had a 23 out of 30, I think it was.
I was not aware.
Okay.
What would you say you do
And some
here?
women develop panic attacks referred to as hypochondriasis. You'd agree with that, right?
Agree with that in reference to.
Lindsay, she had panic attacks and complained of having panic attacks.
Yes.
Okay. And then you can get into the various diagnoses of which, on a postpartum person in that time frame, obsessive compulsive disorder, OCD, right?
Correct.
Or bipolar 1 or bipolar 2, right?
Are you using them interchangeably or could develop?
Trust me, let's say bipolar 1,
Yeah.
okay? So that would be one mental disease, correct?
Correct.
And it's pretty serious stuff, right?
Yes.
And if a person is diagnosed as bipolar, one of the things that you shouldn't, if you know, is prescribe SSRIs such as Prozac or Zoloft, right? If you know.
I'm not sure of that.
Okay. Would you agree that with various cases dealing with postpartum depression, all of the symptoms that we talked about, they utilize the Edinburgh Postnatal Depression Scale, which is a 10-item questionnaire that can identify women that have postpartum depression and the severity that they have. And on the scale, a score of 12 or greater it raises concern and indicates a need for more thorough evaluation, right?
Correct.
Do you know whether she was thoroughly evaluated by anybody other than Tufts and Gelada?
I'm only aware of Tufts and Gelada.
Okay. I mean, you were trying to do the best you could with what you had to work with, right?
Correct.
Okay. Now we get to postpartum psychosis. That's the third category, right? Postpartum psychosis, you'd agree, is the most severe form of postpartum psychiatric illness. Is that right?
Correct.
Would you agree that it occurs in averages about 2 out of 1,000 women, right?
Correct.
And its presentation can be very dramatic with onset of symptoms, and that can be within a year, according to the CDC, Center for Disease Control, right? Okay. And when it hits you, it just hits you, bang, quick, right?
Correct.
And when you think about 2 out of 1,000 people, seems like a daunting number, but if I tell you that Fenway Park, when they're full, when they're playing the Yankees, they have 37,700 people. If you take the 37,000 people and you multiply it by 2, that would mean as you're sitting there behind first base, 74 women possibly have postpartum psychosis, right?
Not sure.
Powerful, because it takes it out of the abstract. Most people, and I would count myself among them, wouldn't be able to extrapolate what that number, what that diagnostic criteria and that probability means. But in that simple little analogy or, thought experiment, he was able to explain just exactly how many people could be struggling with this if you just did the population of, oh crap, I know we didn't, Fenway Park maybe? Wrigley? I wasn't paying attention to the actual park. But this is a wonderful example, and you can't teach relatability like this. You either have it or you don't. You are either able to take a complex, concept like 3 out of 1,000 and extrapolate it into a way that the human brain can understand, or you can't. Thank you, Fenway. I was like, I know I'm going to disrupt the sports Ballians if I don't get this right, but I wasn't paying attention to the park. R.J. Wright, the novelist in Good Morning, Dragon's Gravy. I don't understand this prosecution. This isn't a Diane Downs situation or a Suzanne Smith situation. This woman is getting more tragic than Andrea Yates. Yeah, and even in the Andrea Yates trial, there was indication the Yates, it's a different thing, but the Yates actively did not listen to medical advice. The doctors in the Yates case were saying, she's suffering from postpartum psychosis. Please, please, please do not have any more children with her until we can get her regulated. And they refused medical advice. So this is an apples and oranges kind of thing. Andrea Yates and the Yates family, which is it's a tragedy beyond words, but they refused to listen to doctors. This woman, Lindsay, was asking doctors, please help me. I feel I want help. I want help. I want help. And they said, you don't have a plan. Go be quiet in the corner until you manifest a unicorn. So RJ Wright, I am like you. I honestly do not see the point of this trial other than to hurt Lindsay. I have run all the permutations in my head and would welcome chat if you see any other reason why the Commonwealth is doing this other than to punish Lindsay, because I just don't see it. Jen the Couch Fairy, from the provider's perspective, though, they have to distinguish the 74 who have psychosis from the 73,000. I think that the effort is worth it when dead children could have excuse me, could result from not looking. So yeah, I am not saying that being a mental health clinician is easy. You have to actively work against, subconscious masking, societal norms, and you have to observe everything, translate it from the patient's language, how the patient is putting things versus, reality. So it is a daunting, incredibly difficult job. But that going in. So when you fail to do even the baseline, the results can be catastrophic.
That number, but
Well, if you agree that it's 2 out of 1,000, according to the studies and the statistics, and if Fenway Park has 37,000 seats, times 2 would be 74.
okay.
That's a pretty large number of people, right? 74 people out of that crowd? Okay. It's not that horribly unusual. I mean, it's something that perhaps you've dealt with in your practice, right?
Yes.
And when you're dealing with people with postpartum psychosis, do you agree that generally they present with an episode of bipolar illness? If you know.
No.
No, they don't, or no, you don't know?
No, I don't know.
Okay. Bottom line is, from your dealing with Lindsay, she appeared to be sincere, right?
Correct.
She appeared to be looking for help, right?
Correct.
She appeared to be hurting, right?
Yes.
Turning in every direction she could for help, right?
Correct.
And the last time you saw her was when?
December 19th.
Okay, thank you very much.
Attorney Bucky.
Briefly, please.
Ms. Dukes, you indicated that you didn't review the records of Nurse Paula or Nurse Gelada.
Correct.
Why?
I wanted to have a fresh set of eyes to look at the situation and to assess it when she came in for her visit. That's typical practice.
And that's why you do an entirely new process, right? Where you do your own intake, you assess diagnostics for determining whether there's any.
Commonwealth, I thought you were supposed to be proving your case, not covering your witness's ass. Interesting strategy, though. Covering for clinicians, interesting.
Sort of mental illness, right?
Correct.
And while you can collaborate or speak with the providers about an overall treatment for the patient, your therapy is your therapy.
Correct.
And as far as your role, you don't have any role in medication management, do you?
No, I don't.
Okay. And so when the note read current medications, is that just based on what pre-fills for the patient based on their historical records for the clinic?
Yes.
And so you don't know what she was prescribed and when, and if all of those prescriptions were active. You just know what's in the computer.
Correct.
And as far as the timeline here for the recommendations for partial hospitalization, I just want to make sure that we're clear.
Yeah.
You had been for some time recommending you
Correct.
program in Norway.
Okay, I just want to get to Reddington's recross.
Laughing.
Not that she was laughing, but that she was able to laugh.
Able to laugh.
Yeah.
Okay, because I'm looking here on December 19th, telemedicine. Letitia, I apologize, Dukes, perinatal behavior health program, and you talk in that form about the date of the service, December 19th, psychotherapy, PCP, Margaret, that would be the primary care, Margaret Anastasia. Perinatal behavioral health program, you talk with a quote, if this is telehealth visit, please dot the phrase video visit, whatever. Therapeutic intervention, she's 32 years old, married, female, presents for postpartum anxiety. Symptom management, patient continues to have low mood and numbness. Numbness. Was she laughing when she had numbness?
What date are you looking at?
December 19th, the last day you saw her, or the last time you had any contact with her.
She didn't appear to have that, no.
She didn't appear to have what, laughing or numbness?
Numbness.
Well, it says right in the notes, does it not? The patient continues to have low mood and numbness.
Yes.
Okay. I don't want you to say yes unless I just show it to you. So, very good. Patient continues to have low mood and numbness, right?
Correct.
Patient has not had suicidal ideation and did not need crisis intervention over the weekend. In other words, she didn't kill herself, right?
Correct.
To help with the mood, patient has been spending time with her husband, children, and exercising, right?
Yes.
And exercise is one of the things that you would generally, your people would generally recommend that the mother do, right?
Correct.
That's a good thing to try to do, is to exercise, right?
Correct.
So the fact that the government has records that show that she would take her kids or her husband would take her kids, or they would go to a local gym and exercise or swim, that's consistent with what she was advised, right?
Correct.
It doesn't mean that she's just out there having a good time exercising, right?
Objection.
No, overall.
She was told that that's a good thing to do, right?
She was told that that was a good thing to do, but the fact that she's able to follow through and do it shows improvement.
Oh, okay. So when did she go to the gym?
She didn't give me exact dates. These are things that she told me she did.
Did you ever ask her, if you're telling me that, this is showing improvement, is it in the records? Does it indicate that you asked her if she was exercising, and if so, where and when?
And I want the Commonwealth and the medical practitioners on the stand to be very aware that Rosemary, I am probably going to butcher her last name, Shapashino, is watching. She has been there, I believe, as every clinician. She is heading the civil case. I have not had the pleasure of watching her in court myself, but I have heard very good things. And she's a firecracker. And if you think that Reddington is interesting to watch and is holding people's feet to the fire, we have not seen anything yet, according to what we are in store for when Miss Rosemary gets her hands on this civil case. So do be aware that this is being watched not only by the weird side of the court of public opinion, but the professionals involved in the civil case. And if you don't think that every single testimony is being analyzed with a fine-tooth comb, then this is some 4D chess.
So we don't write down everything that we talk about in the meeting, is particularly a summary of that visit.
Okay. And all I did was ask you about patient was spending time with her husband, children, and exercising. And then you said that that's an indication that she's...
Yeah, Jen, what is strikingly terrifying to me is that Lindsay's prevarication on the medication, to me, if I were a clinician, if I were playing clinician, would be would be an example of intrusive thoughts, of not a harm ideation, but they would be to me, they would show or represent a manifestation of intrusive, constant cycle of worry, a thought pattern that she could not rationalize her way out of after taking steps to rationalize her way out of. Now, I haven't had all the doctorology learning, but I'm sure there is a clinical term for that. And you would interpret, you wouldn't just look for the horse, you would look for the zebra. It's presenting like a horse, but could it possibly be a symptomology of something else? Is how I thought mental health practitioner, clinician-ing worked.
It's improving.
Correct.
Okay. And then I asked you if she's going to a gym. That's not a bad thing, is it?
No, it's not.
Okay. And then it says that she received a call, and counsel asked you about this. She received a call from women and infants, but missed the call. Do you remember that? Remember the DA asking you that question? You said that she missed the call.
Yes.
She didn't continue to read that the reason she missed the call is that she was at another medical appointment, right?
Correct.
And she called you back, right?
Yeah.
Okay. Clinician, you provided contact information for women and infants. Patient reported that she would contact them today, being December 19th, but in fact, she did, and you did with, back it up. She did with your help, and she then went the following day on the 20th, right?
Correct.
Okay. And finally, fair to say that nowhere in here does it say that she was laughing?
You would have to go to the assessment, the risk assessment.
Okay. Got it? Let's see, please. Okay. Now, what's a mental status exam?
So a mental status exam is to assess how the person is appearing that day, their mood and their interaction with you in that visit and how you perceive them.
Okay. So, with the help from the DA, we have December 19th, the telemedicine form, clinical notes, right?
Yes.
The laughing wouldn't be in that area, would it?
No, it would be more so in this area.
Yeah, okay.
Yes.
Mental status exam, right?
Mhm.
Appearance, hygiene, WNL.
Within normal limits.
Okay. Clothing normal, eye contact normal, build normal, posture normal, body movement normal, right?
Yes.
Behavior is cooperative, right?
Yes.
And speech is within normal limits, is that correct?
Correct.
Emotional state, affect. Patient reports feeling numb and having low mood for most of the day, right?
Yes.
Facial expression, other. Facial expression, calm, was able to laugh and smile, right?
Yes.
Would that be in response to you saying something funny, or why was she laughing?
That would be in response to me saying something funny.
So you guys were kind of bonding a little bit.
Yes.
All right. But she basically still continued to report that she was numb, having low mood, and basically the symptomology that she had already reported, right?
Correct.
Okay. Thank you, ma'am. I appreciate it.
All right, Como.
Nothing further, thank you.
All right, thank you. Thank you. You may step down. Thank you.
Good afternoon, sir. Stop right there.
Good afternoon. Do you solemnly swear that the testimony and the evidence you shall give to the court and the jury in the matter now pending between the Commonwealth and the defendant are the truth, so help you God. Thank you, sir. You may have a seat.
All right, good afternoon, sir.
Afternoon, Your Honor.
All right, Ms. Buckingham, please.
Thank you. Sir, could you please tell the jury your first and last name?
Cameron Daly,
And how do you spell your first name?
Cameron.
And can you just spell your last name for the record?
Daley.
And where do you work?
Duxbury Police Department,
How long have you been there?
6.5 years.
And back in January of 2023, what was your assignment then?
Patrolman.
And I'm going to draw your attention specifically to January 20.
No, thank you for your service as a first responder, sir. It looks like he's talking about Lindsay Clancy and just keeping custody of her, but
Take the afternoon recess at this point. The plan would be to come back approximately 2 o'clock, come right back and resume with the Commonwealth's case. And remind you again, I think you probably know what I'm going to say. No talking. All right, yeah, ready for the jury.
All right, jury's in. This court's now in session. Please be seated.
Your Honor, for the purpose of the record, we return back to the trial of Commonwealth versus Lindsay Clancy. All parties are present, including the defendant and including the 18 jurors.
All right. Everybody, thank you for your patience. We'll give you a couple extra minutes to look at the solar eclipse while you're up. So what we're going to do is we're going to return now to the Commonwealth's case. And Commonwealth, could I call your next witness, please?
So prior to the witness, Your Honor, I would just move to enter in as the next exhibit. He excerpted pages from the South Shore Health System Perinatal Behavioral Health Program regarding the last witness, Letitia Dukes.
Okay, any objection?
By agreement, Judge.
All right, so it's by agreement.
226.
We would call Nicole Bradley as the next witness, please.
Thank you.
Just for the record, Your Honor, I object. It's not contested. I don't think it's necessary, so I object.
All right. Same finding.
Yes.
Good afternoon. You start right here, raise your right hand, please.
Good afternoon. Do you solemnly swear that the testimony and the evidence you shall give to the king and the jury in the matter now coming between the Commonwealth and the Senate shall be the truth, the whole truth, and nothing but the truth, so help you God? Thank you. You're gonna sit.
Watch your step, please.
Hey, good afternoon.
Good afternoon, how are you?
Good, thanks. Just going to ask you to keep your voice up so the jury can hear you and speak into that microphone, okay?
Okay.
Thank you. Yes, come on.
Thank you. Could you please tell the jury your first and last name?
Yeah, Nicole Bradley,
And where do you work?
Plymouth County Sheriff's Department.
What do you do there?
I'm an Assistant Deputy Superintendent of the Field Services Division.
And as one of the roles of the Field Services Division, does the Sheriff's Department engage in what's called hospital watch?
Yes, we do.
Can you tell us very briefly what that is?
Yep. So if any safekeep, detainee, or inmate goes over to the hospital, we use our deputies and matrons to cover them on a security watch.
And are the employees from the Sheriff's Department who are on those watches required to log the activity of who comes and goes from the individuals who they are there to watch?
Yes, they are.
And are those records kept in the normal course of business of the Sheriff's Department?
Yes, they are.
And you're familiar with those records and what they look like?
Yes, I am.
If I may approach?
Objection to the record.
Okay. All right. You want to approach and then?
Yes, please. Thank you.
Then there'll be no objection.
Just going to show you a packet. If you could take a quick look at that.
Yep.
And does that packet reflect the hospital logs that are kept by the Sheriff's Department?
Yes, they are.
And you're familiar that between January 25th, 2023 and February 3rd of 2023, that the Sheriff's Department engaged in hospital watch on a patient by the name of Lindsay Clancy.
Yes, I am.
All right. Those may be admitted.
227.
No, I remember that the hypothesis cooked up by Cletus, the trooper, and the other trooper, thinking that the psychiatrist the defense hired decided to throw away all ethical sense and his licensure to cook up this fake psychosis scheme with the door either partially opened or deputies standing right outside the door, has decided to engage in clandestine obfuscation of justice in a hospital room with Lindsay Clancy, Patrick Clancy, and at the behest of Kevin Reddington. Basically, the supposition here is wild. But that is where the Commonwealth is going with this. Yes, the psychiatrist hired by the defense cooked up this whole hearing voices thing. It's a total fig Newton of his imagination, one he is willing to stake his entire professional career on at the behest of Kevin Reddington because he is so awesome. Is legitimately what the Commonwealth is trying to sell here.
No further questions. Thank you.
Mr. Reddington?
No, thank you.
All right. Thank you.
Thank you very much.
Commonwealth calls Dr. Renee Stonebridge.
Same objection as decided by a judge.
Okay.
It's not contested. It's not necessary.
All right. Same finding, same analysis. Thank you.
Now, we're not going to do this. What we are going to do is go ahead of this witness or finish this witness. But I have one thing to say, and I don't have a lot of words all the time other than snark. Because I'm not going to listen to Cora's last moments. They were stipulated to, but if you were a mom and you ever felt terrified of the thoughts in your head, or, overwhelmed or not heard by the medical establishment, I feel like this is what's happening across the internet right now, with the exception of a few loud, ignorant voices. This is what actually is happening right now. And I don't have much more to add to it other than thank you, Kevin Reddington, for being there and being an instrument of human comfort to Lindsay. Because, look, you can like her, you can hate her, but I think that the world needs a lot less judgment, and a lot more human kindness. So thanks for being an instrument for that.
All right, George Edgar.
No, Gail, apparently one of the many operating sort of scenarios slash theories of this case from the Commonwealth is that while Lindsay might have been experiencing, baby blues or postpartum depression, she had no symptoms of psychosis until this uh, defense expert came in, and all of a sudden she said she heard voices. We did skip through the entirety of the medical examiner's testimony about the autopsy of Cora. Um, the defense stipulated to the facts that Cora passed away. I didn't want to hear Lindsay sobbing. I don't know for what purpose it was um it was done other than malicious pain infliction. And you don't have to like Lindsay, but you should want your Commonwealth to put on a case that is worthy of having the government behind it. And so we're skipping ahead. Um, I don't recommend that you watch it. I'm not Cher. I'm not Oprah. I am not your personal guru. But I do know that I can't hear someone suffering like that and sit silent, and it tears me up, and I don't care if you're the worst person in the world, but there are some of us who are compelled to just help and offer human kindness. Um, so there you go. And thank you, Linda or Linder. Thank you.
This court's now in session. Please be seated.
Your Honor, for the purpose of the record, we return back to the trial of Commonwealth versus Lindsay Clancy. All parties are present.
I also can't hear that, you guys. I heard it once in real life, and the sound of a person's soul breaking, again, you don't have to like the person, you don't even have to know the person. If that doesn't move your soul, I don't understand you, and I don't mean that with any cruelty, I don't mean that, but I have never been able to ignore that. So understand that the offering of human comfort, of compassion may look alien, may look incomprehensible to you, but there are certain people who our personalities, our very cellular makeup cannot stand to hear someone in pain without doing something about it. Um, so for those that maybe just don't understand the sympathy and empathy that some of us are able to give, that's the only way I can explain it, that it feels like a magnetic pull, like a force. And I suck at it, you guys. Like, I pat people, but it is a magnetic force such that I will go out of my comfort zone to want to offer comfort to complete strangers. And I know I offered it in a really bad way, but it's there, it's a need, I see it, I am compelled. So, thanks for being okay with us just skipping it and honoring it in our own way and moving forward. because my life is a constant struggle between 2 type A to function and being very upset that we are not directly on time, with the trial as it is going forward, and the other part of me recognizes that this is a lot, and we'll just take it as it goes, because right now that's more important than being on time and keeping current with the trial, in my opinion.
Including the defendant and including the 18 jurors.
All right. Well, members of the jury, I just kind of want to revisit an instruction I've given you a couple times, I think, during the course of this trial. It's important to understand and remember that sometimes there's evidence that's presented in the trial that creates an emotional reaction. All right? But as jurors who have taken an oath to follow the law, I'm instructing you that the law says that you must separate any emotional reaction on your part from the informational value and weight that the evidence produces. Your verdict in this case is going to have to be based solely on the evidence, and it cannot be based on sympathy or anger or passion or prejudice. All right? So you've got to keep that in mind. And so with this, we're going to go to the next witness. Okay.
Commonwealth calls Dr. Wagner Vidal Olson.
Oh, Jesus. Is there another one?
Same objection.
All right. Same finding and analysis.
Afternoon, ma'am. Sound like you're raising your right hand to the clerk, please.
Good afternoon. Do you solemnly swear that the testimony or the evidence you shall give to the court are now pending before the court?
I do.
Also, can we say, court clerk, stay here. I love you in heart. Like, this is full Barracuda mode, and I love this. Stay away from pastels. They wash you out, and they're just. I don't like them on you. I see you as a white snake kind of gal. Never pretend to be a Laura Ashley kind of gal. You are a white snake kind of gal, and I dig it.
Watch your step.
Oh crap! Nope.
All right. Good
We
afternoon, Doctor.
will also be skipping ahead on this one. And here's the other thing I'm going to say. Again, maybe compassion looks strange to you. Maybe this level of being able to just not stand human suffering is anathema to you, but don't shame someone whose innate DNA built makeup means that they offer comfort first. Our society works because we have people like me who are compelled to offer human kindness. And then there are people that, will stand back and say, wait, let's logic this all out. Let's look at the fact pattern. Instead of celebrating that, yes, my compassion and my empathy is not going to be performed the same way yours is, we want to judge it and call it weird and call it, that's a little odd. Again, the world has enough judgment. We don't need that. But what we seem to have a clinical starvation for, a lack of, is compassion. And I would think that anyone showing it in any way should be celebrated rather than, critiqued. But it is current day that ends with Y. So why am I shocked that the internet is confused by genuine human compassion?
All set.
Yes, I am still under oath.
I would say that this look kind of like they almost appear to understand how badly they have screwed up. But that would take a level of introspection that these two have, like their inner eye has glaucoma. I honestly do not know by what matrices they think that they are achieving this case, like how they feel they are performing. Because part of me would love to be able to empathize with their worldview, but I am coming up with, and there are very few times when I cannot actually empathize with a completely alien point of view, given enough information. But I legitimately like I can go full Will Graham if you understand the Mindhunter reference. It's not something that's easy or comfortable, but I can do it. I legitimately cannot do it with their mindset. There is too much internal contradiction and illogic that I do not know what they're trying to achieve. It makes because people, for as complicated and as illogical as we are, we usually have base motivators that are uncomplicated and fairly straightforward. But none of the permutations that I put in make any sense.
What? All right, jury.
Your Honor, for the purpose of the record, we return back to the trial of Commonwealth versus Clancy. All parties are present, including the defendant and the 18 jurors.
All right, Attorney Sprague?
Thank you, Your Honor. You had described previously the injuries to Cora's neck. Were there also
Dang it, I thought we were sorry, guys. I thought we were past her. This is alright, you guys know. Let's it doesn't look like there's anything more, so we are going to go to current day. Let me see if this will switch without being a butt monkey about time and stay at opening. Now, I haven't been watching ahead very much because I didn't want us to um, get any sobbing or anything like that. But I don't know who's up next or anything like that. Normally, I do kind of have a fig Newton as to who's coming up, but I do not know today. Did we have an extraordinarily long sidebar? Oh, wait, sorry. Okay.
Good morning, Your Honor. May I proceed?
Yes, please.
Your Honor, before the court today, we have the matter of Commonwealth versus Lindsay Clancy. Ms. Clancy is present. She is represented by Attorney Kevin Reddington. The Commonwealth is represented by Assistant District Attorney Jennifer Sprague and Assistant District Attorney Shannon Buckingham.
All right, well, good morning, everyone. Good morning, counsel.
Morning, Your Honor.
Good morning, Ms. Clancy. All right, before we bring the jury in, could I talk to to counsel over here just for a few minutes?
We are really taking a long time for a sidebar and getting the jury in today. Now, typically, Law and Crime and Court TV both start about 30 minutes before court comes into session, but this is one of the longer kind of gaps where the attorneys had to work things out in sidebar. Now, I believe he was talking to, oh god, her name escaped me, but she's got the most awesome punk rock hair. Oh god, what is her name? She's a badass. She has a name. The civil attorney. I believe he was back talking to the civil attorney whose name escapes me right now with a badass haircut, who reminds me of Annie Lennox. Rosemary. Thank you guys. Thank you guys. I suffer from inability to remember nameosis. But I remember like facts about or like character traits about your face, which is not always helpful. Um, but thank you guys. Thank you, chat.
Your Honor, before the court is
I'm going to ask you those questions. So I think, again, thank you for I think it's a little bit different. All right. And a lot of it is because of the progress of the case and kind of where we're going. I anticipate we're going to hear a number of witnesses today, and we may break early. All right. And then because of some of these issues, we're not going to be sitting tomorrow. All right. So you don't have to.
Okay, then what we are going to be doing tomorrow is Snarks and Craft. I will be working on probably my Friday disco cowgirl bow headband ensemble, and I will probably after Mornings with Mo redirect you for the first inaugural live stream on my craft channel, uh, where we will be working on Snarks and Craft and Friday the bow. We just need some some sanctioned shenanigans of a therapeutic arts and snarks and craft variety. So and yeah, Wolfram, the prosecution in the case are being purely vindictive toward the defendant while trying to pull in the heartstrings of the jury for the children. So that is my tentative plan, but it will probably be later in the day, in the afternoon, because I am still working on being comfortable and setting up the brand new headset of fantastical fantastical like difficulty. It has all the bells and whistles of which I am not comfortable, but that will give me enough time to kind of get my craft space organized, and get all of everything set up and checked without putting myself into an existential, panic spiral. So we needed a day off, and I think the judge is being strategic here, especially after the shit show that yesterday was. Whether intentional or not, in shortening today, um, he he is in his own way taking care of the jury, and it is nice to see a judge who is aware of the mental toll of a case like this. Not that he has, not that it's within his function to do a whole lot, but it would not be beyond my imagining that he talked to both sides and said, "Hey, the jury is running out of steam here. This week has been incredibly hard. Why don't we schedule this, and this for Friday and send them home?" So I would not be at all shocked if this wasn't somewhat strategic on the judge's part, and I appreciate that. I could be reading more into this situation than not, but he does seem to be strategic on when they have a break day. It's at least in the several weeks that I've covered, in that when they have a really hard day, they will have a shorter day or a half day very close in proximity to that. So it wouldn't be shocking to me if this was a bit strategic on the judge's part, and I appreciate it.
Come in. You can come in if you want, but we're not going to be sitting on this case. So my suggestion would be not to come in and to take that and kind of, and just relax as best you can. And then we'll come in on Monday at 9 o'clock, and then expect kind of most of those days then going forward will be mostly kind of the schedule we had the last maybe 3 or 4 days. All right. So I just kind of wanted to give you that as information as early as I can so that we confirm that today. So probably an earlier date today, and we're not sitting tomorrow. Okay? And so with that, we're going to return to the Commonwealth's presentation of evidence. And Commonwealth, will you call your next witness, please?
Thank you. Commonwealth calls Kyle Paveo.
Oh, well, I lost a magnetic ball. Good Lord, where are they getting them from? Nova Scotia? Schenectady? Did they lose them? It's not boding well for the Commonwealth. Oh, there he is.
Good morning, sir. Good morning, sir. Can you start right here, raise your right hand for the clerk, please?
Good morning. Do you solemnly swear that the testimony in the evidence you shall give before the jury will not contradict the Commonwealth and the defense? Thank you, sir. You may have a seat.
Just step, please.
All right, good morning, sir.
Good morning, Your Honor.
That's great, please.
Thank you. Good morning. Can you please state and spell your name for the record?
Kyle Paveo, Kyle, last name Pavao,
And where do you work?
Massachusetts State Police.
How long have you worked there?
Who do I need to shame for the lip smacking? And why is it look, do you have to have a phallic head shape? Must you look like a bellend or be willing to shave your head to look like a bellend in order to work for the Massachusetts State Police? I mean, at this point, I have seen enough of this that I need to know if it's a hiring requirement or if it's like a nature nurture thing where you just go like sympathetically bald and start looking like a peen, or what is going on here? Because correlation and causation, yes, loosely attached to each other, but this is now example number 11D12 of this particular phrenology, and I have questions.
8 years with 18 total law enforcement experience.
So you worked in law enforcement prior to the state police?
Correct.
In what department?
Town of Mattapoisett.
And are you,
What in the hell is no, my Tismy brain cannot deal with this. His eyeballs are able to blink independently. That's usually something that you cannot control. You cannot blink your eyes. Like if you say blink and not wink, your eyes will go down at the same rate. Oh my God. His eyes don't do that. This is the strangest. We're slowing this down. I have to investigate. Welcome to the Real Trial Watch with Mo, where we simply get confused as to the eyelid movements of a person. Holy cow. Watch this.
department?
Town of Mattapoisett.
And are you,
Okay.
in a,
Sorry, you guys. I will go Zapruder film this on my own time. I apologize. But now it does look like it is probably a medical condition, and he does have a bit of either lazy eye or whatever you medically call that. So I am sorry, sir, if my brain just zeroed in on your biggest personal insecurity. It is just how God made me. I am very sorry that your personal insecurity is the first thing I notice. It is something that has been a struggle all my life. So I do apologize if I have just noticed the one thing you were trying to make sure no one noticed. This is a personal thing that I've done all my life.
specific role or unit at this time?
I was.
What do you do now?
Now I'm a sergeant in field, assigned to the Bourne Barracks.
And previously, where were you assigned?
I was a trooper in the cybercrime unit.
How long were you in the cybercrime unit?
Roughly 3.5 years or so.
And what is the cybercrime unit?
It's the state's primary child exploitation unit. Assigned to that, or included in that, is also a forensic branch, which deals with multiple other crimes other than child exploitation.
Would it be accurate to state that you are able to examine digital forensics like computers and phones that are related to other cases?
Yes, correct.
Do you have to have specialized training to be in that unit?
Yes.
What type of specialized training did you have?
So I am a certified forensic computer examiner. I'm a certified forensic Mac examiner. I'm a Celebrate certified mobile examiner, and I'm a Magnet
Okay, yeah,
certified digital.
I don't care where you got certified at the Geek Squad. Let's get into the actual point. All right, is there...
phone stuff, but they primarily focus on computers.
To be certified in Celebrate
Oh,
and Magnet,
God.
did you have to take classes?
Yes, he took about 10 hours worth of classes. We've been through this in the Karen Reed trial. All right.
Typically referred to as cell phones. So this is a computer image. So this was an actual EO1 file, which is an in-case forensic file. So what it does is it copies out the bit for bit data on the particular drive that you targeted at. And then the in-case file sort of compresses the forensic image. It also adds some metadata to it. You can type in like case files. It keeps some integrity to it.
So is it basically you take a computer or a cell phone and you make an exact copy of the data that's on that cell phone or computer?
Yes. Computers, yes. Cell phones, no.
But you were working on a computer or a Surface Pro?
Correct.
And
okay, I just need to have... I need you to have a lollipop and say, "Who loves you, baby?" All I am hearing is Kojak. All I am hearing is Kojak. My camera person, could you stop focusing on the witness? He's distracting. They need to have like a neurospicy filter so I can just get him and blob him out so that I just listen, because y'all, the struggle is real over here. I am desperately trying to listen to this man and not see him. And I know this is a personal struggle. I know this is... I am supposed to be in serious mode right now. I get it. I get how ridiculous it is that as an adult, I cannot tell my brain to stop noticing that his eyes don't blink together and that I want to shout out which one's the glass eye and give him a pops, or a lollipop, and tell him to go full Kojak, and this is the only way that I'll be able to listen to his testimony. But this is in fact the internal struggle I am dealing with, you guys. Yeah, he would have to pretend like he had even a casual acquaintance with testosterone, but look, have we not had to make this easier on me? Sorry for this tangent into tangentness.
so the extraction for the Surface Pro would be a copy of the data that was on the Surface Pro.
Yeah, so the image in this case is a bit for bit copy of that drive.
And when you do the extraction or when you view the extraction, are you changing any of the data?
No, that's why we use these types of images, so we don't touch the actual data on that computer.
Did your initial review of the extraction show a visit to a website entitled Suicide Methods on August 23rd, 2022?
It did.
Were you recently asked to look at that visit to that site to get a better understanding of how that website was accessed?
That's correct.
And how did you approach that?
I set a parameter. I went to that artifact that I had previously tagged when I did the initial analysis.
Let me just stop you there.
Sorry.
What's an artifact and what is a tagging?
So an artifact is every single piece of data on that computer is an artifact. So a computer could have 500,000 artifacts, let's say. That's a low end, but as an example. So tagging would be something you would flag that one particular evidence, that one particular artifact as evidence.
So in this case, the artifact was the visit to the website, is that correct?
Correct.
And then the tagging was just so that you could find it when you went back into the extraction looking for it?
Yes, correct.
And so if you could continue telling us about how you approached that.
So I set a parameter of 12 hours before the visit and then 12 hours after the visit, and looked at the correlating other digital artifacts related to that.
And can you tell us what's a Chrome history database?
So that's the, so a database essentially, this is a very,
Oh God. No. What actually did you find? Where did Lindsay pull, I am a manipulative cow who wants to unalive my children?
so I saw
Site suicide method.
go back in later. It started like in the mid 90s or so, but you can go back to pick a date, pick a year, and you can see what that website looked like at that time, or approximate. It doesn't copy minute for minute, day for day, but you'll get something around the time that you were looking for of what a particular page looked like at that date and time you want to.
How does getting an approximation of what a page might approximately have looked like on a particular day give you insight into what a person was looking for if you have an approximation? If you do not have the actual thing that that person looked at and you are looking at a facsimile, how do you know that you're getting an accurate read on what reason they had for pulling it out when you used a substandard Wayback Machine?
To see.
So with regard to this case and looking into how that site suicide methods was accessed, what did you learn? Or what did you see?
When I went back,
Yeah, so go ahead.
so I saw the first thing I saw was a Facebook visit.
Okay, we are going to head out of this because I know you're going to be shocked, but all this Commonwealth talk about all these searches, it's going to turn out that we are going to skip right to Reddington because would you know it? Lindsay wasn't even home when the searches were made. We are basically saving ourselves about an hour and a half of our lives that we would never get back. As our patron saint of 50 Shades of Logic over here, Mr. Reddington.
Sustained.
Actually at the computer doing all of this, correct?
No,
You can only see what data there is and what's been accessed, correct?
correct.
Thank you.
All right, Mr. Reddington.
That's it? That's your testimony? That's why you're here today, to talk about search?
Oh, God. Okay, poor Reddington. He has just had enough. We are seeing this man's ability to be professional and and sugarcoat his words. Oh, good. Okay, Reddington, let's go. Let's effing go.
That was involving Tim Hall?
Sustained, if you could.
So I apologize. Your testimony today is based on that search on August 23rd, right?
Correct.
Of 22, right? And you were working as a state police officer back then, right?
Yes, sir.
And were you attached to the Plymouth County DA's office, or were you working somewhere else?
I was assigned to the cybercrime unit.
And the cybercrime unit works with the DA's office in Plymouth?
The cybercrime unit's its own independent statewide unit.
So in the sense that you're independent, it's still the district attorney and his assistant DAs that would reach out to the cybercrime unit and ask for help, right?
Or it could be the troopers assigned to the state police detective unit.
Joshua McGillen. He was the lead investigator on this case, right?
I assume so.
Okay. So you were tasked to analyze the computer, the Surface Pro computer, right?
Yes, correct.
And by all accounts, that was owned by Pat Clancy. Is that correct?
That is correct.
And it was located in his office, right?
I don't know where it was located.
Okay. It's fair to say that when you analyzed the computer back in October of 2025, it was an investigatory role that you were using to locate potential evidence, right?
Correct.
And what is it you were looking for?
I was provided a search warrant with search terms, and that's as far as I knew of
Okay.
the case.
And what were the search terms?
I don't recall specifically, but they were spelled out in the search warrant.
So when you have search terms, you take a person's computer, and then what do? You access it through a device?
So I was provided the images. I never saw them.
Dear Lord, stop with the lip smacking. I don't know who I need to consult. I don't know if I need to get an old priest, a young priest, and a Unitarian, along with an armada of super soakers and holy water. If it's like a cat situation, and the holy water application when the behavior is done would help. But dear God, the lip smacking.
A physical computer.
So when you got the images, you were able to load them up onto your computer, I imagine?
Yes, we'll use a tool to help parse through that data. Correct.
And then as a result of that, you were able to plug in words that you could search for, right?
Yes.
For example, like suicide?
Suicide would be one.
Drugs?
I mean, I don't think that pertained in this case, but
Well,
that
yeah,
you could
believe me,
search.
it did.
That I don't recall the specific terms in the search warrant.
Okay. So after you did your search for whatever it is that you were looking for, suicide and other, you're unable to tell us what else you look for, but in any event, you came across this entry on August 23rd, and you indicated that the time frame that you're dealing with on that computer, the Surface Pro computer, was 9:40 in the morning. Is that right?
Can you rephrase that?
Yeah. You can look at your report too. I mean, if you have documents in front of you, do you have?
I do.
All right, so you can take a look at it.
It's a trap. It's a trap. And thank you, Wolfram, for being an awesome mod. Hope you have a great lunch. No, when Kevin Reddington is being nice to you and you are on cross and he tells you to look at your documentation, it's a trap. At this point, every time he says, look at your documentation, the Commonwealth should just object for no other reason than to break his flow. I mean, because they're objecting to the fact that he's going to use documentation to destroy their witness. But my ears perk up whenever he tries to lull them into a false sense of security.
You have a document that's captioned matching results. Is that right?
I do not have that in front of me, but yes.
And would that be the search that you conducted?
Is that the magnet tool report?
I don't know what it is. And I had research and I can have it see. So it's just, what is that?
Is Mr. Wait a minute, does Kevin Reddington not only have a pair of readers on, but is he carrying a rectangular magnifying glass to make sure he understands this documentation? Just when I think I couldn't love him more. He's like burrowing into my heart like a Lessie with the binders. I just love this man.
What is that?
This is the main page of the forensic tool.
And looking at the main page of the forensic tool, does it indicate the date is August 23rd?
That's the inbox. This also doesn't. Which, are we talking about this highlight here?
Yeah, but what does that indicate?
That's an inbox. That's not that.
All right, so what time?
Cooper, could you keep your voice up or make sure you speak to that microphone?
So that highlight is a bail inbox.
Okay. And that would be the HTTPS. And then underneath that, it makes reference to at some point that you were able to see that Lindsay or Lynn's Facebook account was accessed. And it wasn't even the account, it was actually the homepage, right?
Correct. It navigated to the Facebook person's account.
Okay. So that would tell us that that particular Facebook account was accessed, and then that conducted the search you just testified to at the next thing.
Rogue Mama, I think you know what we need to do. I need a cute little picture searching for justice or JKD Buck. I need a cartoonified looking for the Commonwealth's case. Do. Don't mind if I do. Reminding myself you must do this for yourself too. Even though Grok seems to hate you for reasons that you have yet to comprehend. Download. All right. Check and check. Now come.
This does not have, this here does not have.
Right, if you want. How about this next one? Does that have the Facebook visit?
This one does, yes, correct.
Both must have both lists. Go ahead.
Yes, that'd be right.
All right, thank you. Now, just before I leave, above that, does that also indicate like these what are these two top lines?
That would be that was a CNBC web visit, which was typed in. And then there's access to a Google Gmail account.
And whose
inbox.
Google Gmail account was that?
That I don't know.
Because those two lines and references to the Google account were not in your report, right? You started off with the Facebook search, if you will.
Yes.
So you started off with Lindsay, Facebook, that was signed into the homepage on Patrick Clancy's Surface Pro computer, right?
So my tool report has all of the artifacts tagged as evidence.
Okay. So when you tag the actual data from the Surface Pro and the HP laptop as well, right?
Yes, correct.
And your October report back in was it 25 or was it 22?
25.
So, but nothing changes on the computers. I mean, whatever your searches are and your records don't change over the years, right?
No, as long as it's preserved in that state and the images of that computer will remain the same.
Okay, so, and it's fair to say that with this investigation, obviously happening back in 2022, that the computers were hermetically sealed and stuck somewhere with an evidence locker to make sure that they're preserved, right?
Yes, that would be best practice.
Okay.
That would be correct.
So then in October of 25, the district attorney's office asked you to conduct a search of the computer, apparently. Is that right?
The trooper in the Plymouth State Police Detective Unit reached out.
And that would be McElligan, right?
No, it was not.
Okay, do you know who it was?
Trooper Justin Paul.
Justin Paul.
Correct.
Okay. And as a result of that, you then prepared your report. And one of the things that you did is you noted that on August 23rd of 2022, at 9:40 and 08 seconds, that there was an access to the...
I'm getting evaluated to know just exactly what kind of weird I am. I like it. Oh, a happy poop. I like it, and it's all sparkly. I wish it would pop up on screen and like do happy poop sparkles across the screen. Well, he's assuming a lot for the digital forensic unit of any Massachusetts state trooper office. Apparently, they are all repositories for the mentally non-gifted.
The Lindsay Facebook account, right?
Oh, there was a visit to that page, correct.
Right. And then that page continued on to look for Tom Hall and Walking to Memphis or whatever and the songs, right?
Yes.
On Spotify?
Yeah, the song. Yes, after that was a Spotify.
And then the time frame of that would be that you went to a hyperlink that took them to methods of suicide. Is that correct?
That is correct.
Now, were there any searches on that computer for example, ways to kill?
No, there was not.
To your knowledge, Clancy, or ways to kill? You ever heard that?
In my initial report back in October, that contains all of the evidence artifacts that I had tagged as evidence and provided, I did not come across that, no.
Right. So basically, what you are leaving with the jury would be that on that date of August 23rd, at approximately 9:40 in the morning, and then carrying forward with jumping from Tom Hall to the Wikipedia account to the underlined name, suicide, jumping to that page, that all occurred between 9:40 and say 10 o'clock in the morning, right?
Correct.
Did you know, sir, that on August 23rd, prior to your report indicating the Facebook account, that Mr. Clancy signed in, and it was Mr. Clancy's email that accessed the Facebook account for Lindsay Clancy?
I did not.
And that was not included in your report, was it?
No, it was not.
And you know that the Clancys had 3 children, right?
I did not.
Well, you know that you were working on a case where Lindsay Clancy was the mother, and she was married to Patrick Clancy, right?
Correct.
And did you know, sir, that on August 23rd of 2022, that 2-year-old child was brought by Lindsay to South Shore Health for Dawson's ear recheck, that he had problems with congestion, but no complaints of ear pain, no fever. And that was on August 23rd, 2022, that he was examined at 10:15 in the morning.
I'm not privy to those facts.
So you don't know that Patrick Clancy's email signed into Lindsay Clancy's Facebook account. You're not aware of that, right?
It's whatever the default profile was signed into the Chrome browser.
And then that accessed the Facebook account, which looked up Tom Hall, the singer, right?
Yes, correct.
That then led to the Wikipedia talking about suicide.
That is
right?
correct.
Led to the Spotify talking about somewhere in Memphis, whatever the song was, right?
Yes.
And this was all occurring from 9:40 in the morning until, like I said, 10 o'clock thereabouts, right?
Correct.
You tagged actual data from the Surface Pro as well as the HP laptop, right?
I did.
And your October report contained searches from the Surface Pro, right?
Yes.
And you recall, for example, just a representative sample that, and this would be on the Surface Pro computer. Now we're jumping ahead to December 5, not August of 22, December of 22. One of the inquiries of the Google searches was what to do when a psychiatrist overprescribed, right?
Yes.
Searches for medications, right?
Yes.
Including Lamictal, right?
Correct.
Can bipolar disorder be temporary, right?
Yes.
Can benzos reveal bipolar disorder, right?
Yes.
How long are detox programs, right?
Yes.
What is DBT? I'm just saying that's a search. I don't know.
Oh, yeah. I had to look that one up too.
Okay. Lamictal versus Zola, it says Zolafy, but I would suggest it would be Zoloft. That was a search, right?
Yes, correct.
What is mania? It was a search, right?
Yes.
Ketamine for benzo withdrawal. January 18th of 2023 was a search, right?
Yes.
Ketamine therapy on January 18th of 2023, correct?
Yes.
Now, you know, maybe not personally, but you know Steve Verino, who's also a gentleman who does what you do with computers and laptops and stuff, right?
Yes.
Now, you've worked on cases, and you know Steve, you recognize him right here, right?
Yes.
You know that Steve was working with me and Lindsay on accessing information from cell phones and computers. And he actually, through me, reached out about a month ago to the DA's office and raised some questions, correct?
I'm not privy to that.
Oh, well, the DA reached out to you about a month ago and asked you to revisit your investigation. And as a result of that, you created another report, didn't you?
I did.
And that would just be on July 26th of 26, right?
Yes.
And that was after the DA reached out to you, but didn't tell you it was because we had questions that Mr. Verino asked me to find out about, right?
Yes, I was not privy to that.
So as a result of dealing with the DA in July 26th of 26, you then prepared your report, and the purpose of that report was to find.
Okay, legitimately, I was mom duties called, and then I was perusing X. Who thinks the Commonwealth is doing a good job? I know there are people out there because under every single joke, meme, or thing of me making fun of their bows, or anyone else, there's an army of people defending these two. But how is this a competent case? Show me a whole new world. Like, are the colors brighter there if you're dumb? If you just aren't in touch with reality, is everything awesomer? And I'm not trying to be an ass, but I mean, when 99 or when 93.7% of humanity is on one side of something and you're stubbornly clinging to the 7 or whatever the other number would be, do you ever just look around and think, what are they seeing that I'm not? Or are you so comfortable in the fact that you are right and all of us are wrong that you get more of an ego boost by the, thought that you are the only smart, correct, and right one, that you can't perceive a world in where you could possibly be wrong and there might be truth in the 93.7% of the rest of us? Legitimately, I am asking a question because I don't understand you, and I do, not for mockery's sake, but to understand, like, are you motivated by feeling better than the rest of us, by being on the inside and seeing something the rest of us just aren't seeing, or the moral hierarchiness of, or like, high horse of it all? I legitimately want to understand your perspective because I am bereft of any understanding of where you're coming from. And that's genuinely a confusing place for me. Genuinely, I can understand, if not agree with most perspectives, and understand the merits of them, even if I don't agree with them.
Found out more details, if you could, pertaining to the quote methods of suicide page, right?
Correct.
And in your July 26 report, you then went into detail about your findings, correct?
Yes.
And we would agree that that particular webpage was not a search for methods of suicide. It was actually the Tom Hall and the music, right?
That is correct.
And then the URL shows access to Lindsay's Facebook profile, correct? You accessed and found out that Lindsay's Facebook profile
was a web visit.
Right.
Yes, correct.
But you don't know that it was Lindsay that was actually using that computer to search for Tom Hall, right?
I don't know who was sitting behind that.
You don't know that Patrick Clancy plays the guitar, do you?
I do not.
You don't know that Patrick Clancy is a music aficionado, right?
I do not.
You don't know that Patrick Clancy enjoyed Tom Hall music, do you?
I do not know that.
And you certainly don't want to leave it with this jury that Lindsay was looking up ways to commit suicide in August of 22, do you?
All I'm presenting is the facts that were presented in front of me.
And it was a couple more questions, sir. When a user logs into their own Facebook account, it doesn't populate or bring you directly to the actual profile page. It brings you to the home page, right? That shows your followers and things like that.
I think so. I don't have Facebook or social media, so
right.
maybe, I don't know.
That's all I have for this gentleman, Your Honor.
All right.
I would ask if I could, Judge, the two documents that I was questioning him from, could I introduce those into evidence? I think he agreed that that was part of the search.
Can we just approach?
Sure, yeah.
To have it focused on that. I would offer, if I could, the medical records from the pediatrics associates that,
They're already in evidence.
well, I'd like to have it focused on that. You don't mind if we put that.
What we mark that for identification, we can address whether or not, I want to double check. I haven't gone through all the records either. Oh, I understand. We'll mark that for identification.
Thank you, sir.
Thank you.
235 exhibit for identification.
Sir, just for clarification, before when I was doing direct, if at any point I said August 23rd, 2023, what you did when you did the Wayback Machine was searches for around the time period of August 22nd, 2022, correct?
Correct.
And anything that you looked at that day regarding the search for suicide methods or any of the other places that were visited were August 23rd, 2022, correct?
Correct, 2022.
And the visit to the Grafton Bridge Wikipedia page was at 9:48 a.m., correct? Not 10 a.m.?
That visit was at 9:48, correct.
Okay. And defense counsel asked you about the defendant being at the doctor's at 10:15 a.m. Are you aware that it only takes 4 minutes to drive from her home at 47 Duxbury?
No, 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 no. Oh, no, 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 Commonwealth. We are not playing this. Are you aware that it only takes 4 minutes? You made Lindsay Clancy sound like she sent Patrick to Timbuktu by way of Schenectady with a layover in Atlantis when she sent him to V3. Now, you neglected to inform the jury that it was 8 minutes away from their home. 8. And that the CVS, I think, was 3 minutes away from their home. Adding, again, with this whole schemology that you have built up for Lindsay doing, you cannot have this both ways. It is either a insurmountable distance or not. Yeah, right. And just because something says 3 minutes on MapQuest doesn't mean that you don't get stuck behind the person who feels obligated to go the speed limit for some reason, or that a toddler has a meltdown, or that any number of things will add to that infinitesimal drive. The Commonwealth is trying to kill me. They are trying to kill me with WB logic. And because I am smart enough to not watch, anything from the WB, I am not inoculated to this level of stupid. I need to start watching The View to up my immunity to stupid. I have been avoiding it. I need to start engaging in, like, what is it? Freaking not immersion therapy. I need to start doing it. That and clowns. I'm gonna have to just bite the bullet. Damn it.
47 Summer Street in Duxbury to the Kingston location of the
Okay, no,
pediatrics.
this is so dumb. Reddington, please help us. Help us all.
What has been marked for P for identification, which would constitute the health information records from the South Shore Health, pertinent to the child. You're aware, sir, that the records, or you're aware, sir, you're not aware that the child was brought to the doctor's not at 10:15, but was brought to the doctors around 10 o'clock in the morning. You aware of
I'm not
that?
aware of any of that.
And did you know how old the child was?
Sir, my testimony is related to the.
So you don't? The
computer.
answer is
I
no?
do not. No.
Okay. So is it fair to say, sir, that, I mean, from your life experience, that when someone has to bring a child, a young baby to a doctor, you got to get him dressed, you got to feed him, you got to get in the car, you got to drive? And that's the 4-minute ride as well, right?
I'm not privy to any of that information.
Thank you.
All right. Anything further?
No.
All right, thank you, sir. You can sit down. Thank you.
Commonwealth, this is where, again, every one of us has our proverbial blind spot, and it's not good, bad, or anything. But the fact is that because these two, in the Commonwealth, these prosecutors do not have children, they don't understand the reality of getting children ready for a doctor's office visit. That typically they ask you to be there 10 to 15 minutes ahead. Usually there's paperwork and consent forms to sign. They have to ask, is your insurance still the same? Sometimes I know my pediatrician's office, if my kiddos have had a growth spurt or they've changed in the time that they've seen them last, or sometimes just to make them feel special because they have a, spiffy new haircut, they'll take new pictures for their chart. So there's a lot of little things that, I'm not blaming them or making fun of their ignorance, but it is that ignorance that is a blind spot for them and has them saying these kind of really dumb things if you've ever been a caretaker to a small child. So what could be forgiven as just ignorance because she has been so malicious, because she has been so unwilling to grant any level of compassion to Lindsay, it's very easy to make this a mockery. But, from an objective standpoint, it's just her blind spot, and I get it. And on the surface of it, that blind spot isn't a problem. But when you use that blind spot to make everything malicious that Lindsay did, it really will work against them, I believe. And from a strategic standpoint, I point out that there's nothing wrong with having that blind spot, but not being aware of it and you know, not educating yourself, not asking other mothers, assuming you know what motherhood is like. And it is going to be something that will leave a bad taste in many people's or in many people's mouths, and is going to optically be terrible for you. So take it from, again, the, you know, eccentric side of the court of public opinion when I say it's a very bad look and you are forgiven for your ignorance, but you're not forgiven for your willful adherence to your ignorance. Everyone has blind spots, but everyone can learn about their blind spots. Your refusal to do so, even in furtherance of a good case, it is the kind of intellectual mediocrity that I can't deal with.
Commonwealth calls Timothy Chiappini.
Stop right there. Raise your right hand to the podium, please.
Do solemnly swear that the testimony and the evidence you shall give to the court and the jury will be enough to the Commonwealth and the Thank you, sir. You may have a seat.
Please.
All right, good morning, sir. Attorney Sprague.
What in the cranial peroxide crop circles am I looking at here? What in the follicular peroxide damage? What in the Brad Mondo? What happened here is going on? Okay, pay attention, pay attention, pay attention. You have had your outburst. let's be professional-ish.
Please.
Thank you. Good morning. Can you please state and spell your name for the record?
My name is Timothy Chipini. Last name is spelled Chia, P as in Peter, P as in Peter, I-N-I.
Where do you work?
I work for the Commonwealth of Massachusetts for the Department of State Police.
How long have you worked for the state police?
I graduated the academy in March of 2012.
What is your current assignment?
I am currently the unit commander for the Critical Incident Technical Investigation.
Unit. I thought he said eunuch. Okay. Although that is hilarious with the picture currently on the screen. So my mental reality is going to substitute eunuch, but it's unit. Enunciate clearly. And damn it, lip smack. Also, sir, when you're playing with peroxide, do not touch your eyebrows. I'm not speaking from experience, but I'm speaking from experience. Don't touch your eyebrows. You will end up looking like this, okay?
Team.
How long have you been doing that?
Since approximately April of this year.
What was your assignment in January of 2023?
I was assigned to the State Police Detective Unit for the Plymouth County District Attorney's Office.
Do you have specialized training in cell phone forensics?
I do.
And could you describe that, please?
I was initially certified as a Celebrite physical operator and a Celebrite certified operator, Celebrite certified physical analyst in March of 2017.
And are you also trained in gray key and magnet?
I have been trained in gray key examination since August of 2021, and I've been familiar with the forensic program known as Axiom in that course, but I'm not certified in Axiom.
And regarding Celebrite, can you describe that software for us?
Celebrite is a forensic access and acquisition tool for cell phone or mobile device forensic extractions. It also has an analysis component as well.
And were you asked to do a forensic analysis on a cell phone belonging to Lindsay Clancy in 2023? Oh, I'm sorry.
Yes, ma'am. Celebrite is an access and acquisition tool for mobile device forensics and cell phone extractions as an analysis component for extractions.
No. I know lawyers. This will not happen again. Massachusetts, you will not be. Who do I need to talk to about getting a cease and desist? I still have emotional and mental pain. Allow me. Boston, not again. Not again. I have a demonstrative, you asses. You can't do this to me again, you jerks. No. You said, I think I have something lodged right if I'm feeling it. Okay, so it would be the other half. Right here, right about cheer, and on the scoliolar part, if you need even more. No, I will not be forced into this. Right here in the temporal region, right here is where Massachusetts has hurt me before with this. I will not allow this. This is not happening again. Never again. I am so sorry, you guys. Damn. No, you don't understand. I can deal with nearly everything. Horribly, emotionally traumatic, terrible, soul-wrenching testimony. What I cannot deal with is Celebrate. Explained by a moron. Questioned by a moron. We will be skipping to the Kevin Reddington makes this make sense portion of this trial. I will not be bamboozled again. I am still on the class action lawsuit against the city of Canton, Lolly and Whiffen and all of them. No, I cannot. I will not be arsed, to steal a phrase. I can't be arsed. Come on, Reddington. Make it make sense for me. Although I really do. Oh my gosh, you guys. Okay, on that note, For cosplay court, who am I? Now, imagine without makeup, and then I come back from lunch looking like this from the Karen Reed trial. Like I have been attacked by the or the MAC, the MAC Maybelline counter. Miss Pancake Pizza, hot wings lady, I am still trying to figure out what you are trying to explain. Although I did like your head wrap. I thought it was pretty. I just thought that you getting gussied up for Alessi was probably the weirdest nerd flirting I have ever seen. And as an awkward, nerdy chick too, um, I get it. Look, Alessi had me at binder, so I get it, girl. But you are a little obvi, okay? Like leave the bright red Mac, out of the equation. You could have gone with a neutral and just, zhuzhed up what you already had, but no, you went like Elizabeth Arden, Tanya Harding Dew in between the break and back. It was the most hysterical people watching that I've ever seen in a courtroom because I didn't understand not a word of what she tried to explain or ate to me. Oh God, they're still explaining. We're getting too close to current time. I can't speed up if we're stuck on her. This is terrifying. I'm actively slowing down, like going forward to make sure we don't get stuck with this chick trying to explain stuff. Oh God. Oh yes, thank you.
This court's now in session. Please be seated.
Your Honor, for the purpose of the record, we return back to the trial of Commonwealth versus Lindsay Clancy. All parties are present, including the defendant and including the 18 jurors.
All right, Mr. Reddington?
Yes, Your Honor, thank you. Morning.
Morning, sir.
So you are part of the prosecution team that handles the downloads of computers and cell phones and things like that, right?
Specifically mobile devices, sir, not computers.
Mobile devices, okay. And the other gentleman that testified, Pavo, is that his name?
Paveo, sir.
Paveo. And he did the laptops that were found in the office, in the home, right?
Correct. He has those certifications.
Okay. Now, the district attorney had asked you some questions about different searches that you had done on Celebrate and on Axiom. All your searches dealt with Lindsay's cell phone, right?
To clarify, sir, I did no searches on Axiom.
Okay. You did searches on Celebrate.
It's the only forensic tool I use, correct?
All right. And basically, I'm just trying to get a handle on that you and your other brother or sister officers would examine, for example, the computers that were found in Patrick's office in the house, right? You didn't, but the other people did.
That's correct.
And then you got the computer, strike that, you got the cell phone that was Lindsay's cell phone, right?
Yes, sir.
And you then did, what's called an advanced logical of Lindsay's phone, is that right?
That's correct.
And what is an advanced logical? What does that mean?
It's an extraction that utilizes the iTunes backup of an iOS device, and it acquires most of the user-facing content, meaning calls, texts, images,
okay,
browser history.
So you lost me on user-facing. What does that mean?
What the user sees when they're using the phone.
Okay, so like if you pick up a phone and you open it up, then you're interfacing with the phone and you look.
And I very much like this approach to explaining what the witness is doing because Reddington is not afraid to showcase his lack of understanding of technology. But because he is a fish out of water, he asks the questions that most people, because of ego or not wanting to look stupid, won't ask. And because he's humble and he's like, look, I don't understand technology anyway. He translates it into something that is easy for the jury to digest. And whether this is something he's consciously doing or, just the way he is, it is very, very powerful as a way to communicate really difficult to understand things by, making yourself, you know, humbly saying you don't understand something and then having the expert walking you through and agreeing on your own terms, because sometimes a lot of it is just a translation of terms that are used kind of cross platform by each speaker in the conversation, and they're just not getting here. So by having Reddington kind of walk him through exactly what he means by this and that, he's clarifying without demeaning or dehumanizing, um, under the guise of, I don't quite get this, can you clarify it for me? And that's a very easy way to get people into their comfort zone if they're an expert, to get them into a comfortable place where they're in that professorial mode. But it's also an easy way for him to kind of make this easier to translate to the jury.
Looking at different things, such as photographs, emails, texts, things like that.
Yes, sir.
Okay. In addition to Trooper, now Sergeant Taveo, and yourself, there also was another trooper that you were working with, a guy by the name of Rabbit, like Roger Rabbit, right?
Yes, Joseph Rabbit was assigned to the unit at the time.
See, I would have gone Super Troopers Rabbit, but I love that he went Roger Rabbit. I just love him.
And he also conducted a search, but he did what's called a full file system extraction, right?
I don't recall.
Okay, what is a full file system extraction as opposed to advanced logical extraction?
A full file system extraction would acquire the databases and information that you cannot see as a user on a device.
I see. So your extraction was done on January 30th, is that correct?
Yes, sir.
And Rabbit's extraction was done on January 27th, right?
I'm not aware of Trooper Rabbit's extraction.
Did you ever collaborate with him as investigator investigating Lindsay Clancy on this case?
I always thought he was Irish. Sorry, but that's the only way I translate extraction, and that would have been my honest answer on the stand, which is why you never want me to be your witness.
Talk about what you located or what he located?
I had no discussion with him about the phone extraction.
All right. Is he still working for the state police?
He is.
Would you agree with me that the full file extraction actually gets more information than the advanced logical? In other words, Rabbit's extraction would have got more information than you got on your advanced logical.
That's correct.
So one of the things the district attorney had asked you about was in reference to Exhibit 237. And that would be the Celebrate report. Is that correct? Basically, the caption for the extraction on the Celebrate report.
This is a supplemental report that I completed from the physical analyzer software.
Okay. And would that be Celebrate?
Yes.
Celebrate, before I ask. Looking at Exhibit 237, the second page, that on the very top that I'm looking at here, can you tell me on the right, what is it depicting on the right?
It's
little box. Yeah, I know that. See the little box? Oh, well, you know what I'm going to do? I'm just going to approach you. This here is the exhibit that the district attorney asked you to look at, 237, right?
Yes, sir.
Okay. That It's a Celebrate report, right?
It's a supplemental report, yes.
And that would be the calendar search, right?
The calendar supplemental report, correct.
Okay. So that means that if Lindsay had appointments anywhere, it would have been presumably, if she put it in the phone, in her calendar, right?
Yes.
Okay. So when you looked at your investigation, directing your attention to the start time, what date are we talking about here?
The start time is August 14th, 2022, midnight. End time would be August 14th, 2022, 11:59 p.m.
Okay. So if you look down to the next one, it says, what date?
August 23rd, 2022, 10 a.m.
Okay. And did she make an entry on
did.
her computer on that date and time?
She did, sir.
And can you tell me what the entry was?
Subject is 10 a.m. Callan, Kingston vaccine.
So Callan would be the son. She had it in her phone that he had an appointment to get a vaccine at 10 p.m.
The time is 10 a.m.
10 a.m. Okay. And the next one, what is the next one?
Would you like to know the subject, sir, or the date?
Yeah, sure. Just what the date is and then what the subject is.
Okay. The start time is August 23rd, 2022, 5 p.m. The subject of the entry is 9:45 Kingston, Dawson, ear check.
And that would be indicative of an appointment that she had at the pediatrician's office for Dawson's ear check at 9:45 in the morning. Is that correct?
Could be an inference, I'm not sure, but that's the entry.
Okay.
The inference is inferring, is gathering disparate pieces of evidence and, manifesting those into a theorem beyond you, Columbo. You do realize that your profession is taking disparate clues and making theories, right? Good Lord.
Now, looking at Exhibit 235, you can tell me, what is this document?
I recognize it as a screen capture from an Axiom phone extraction.
All right. And you did indicate you were Axiom qualified, right?
I am not, sir. I'm familiar with the program as a result of my training with GrayKey. Magna Forensics owns GrayKey technology, and in the training course for GrayKey, process extraction is using Axiom, but I'm not certified in the software of Axiom.
But you can interpret it. You understand what that shows you. It's just a listing of different activities on the phone, right?
I'm aware of what the screenshot depicts, yes.
All right. Can you tell me see the highlighted one, can you tell us what that is, the date, the time, and what it's referencing? Do you need a magnifying glass?
Reference is a website, sir.
And what's the website?
Mail.google.com.
That mail, like M-A-I-L, right?
Yes, sir.
Okay. Does it indicate whose mail it is? Does it show it on the right-hand side of the box?
Kevin Reddington and Draco Malfoy and the search for the Commonwealth's case. You know what? I spent most of my life hoping to be normal, but normal would have never made that up. And if normal would have never made that up, then I don't want to be normal because this is boring to watch them both trying to figure out what computerology means.
I can't definitively determine whose mailbox it is.
Okay.
Trooper, I'm going to ask you, make sure you keep your voice up, okay?
Yes, Your Honor.
The next page. It's pretty much the same thing in the same day. Okay. you tell us on that page who signed in under what email?
The artifact is indicating that there's a title with an email.
What's the name? Sorry.
PATRKW.CLANCY@gmail.com.
So that's fair to say that that would be patrickclancy@gmail.com. That's his email that signed in on Lindsay's Facebook.
I can't.
Legitimate question at this point. Is there a point at which the judge can do like a mercy ruling? Because basically what just happened there, if you don't understand, is the question that he had asked the last witness who was supposed to be certified in the computerology that he was testifying about. The last witness said that he was unable to tell whose email was linked to the suicide search while Lindsay was at a doctor's appointment. Well, the Commonwealth tried to correlate it to the fact that after those searches, the computer then went to the homepage of Facebook, which happened to be open to Lindsay's, profile. However, the very next page that was searched was Patrick Clancy's personal email. I mean, at this point, if I were the elected DA, I would be beside myself with how terrible this is looking.
Confirm that.
And when you were going through her phone, is it fair to say that, there wasn't much in her life that wasn't exposed to the state police and the DA's office and the investigators? Your report initially was 180,000 pages of PDF, right?
It was a very large download, sir.
Does 180,000 sound about right?
It does.
So 180,000 pages on a PDF, you do a number of extractions, and then you get into the one that you were testifying about. The district attorney indicated that you stated that it was 768 pages of text messages that she had, along with photographs perhaps.
That was a timeline search. The number of items in that report are indicative only of the time frame in which I was utilizing within the software.
Okay. So when you went through her phone, did you come across on a Celebrate report searching for where is the carotid artery?
I don't recall.
Did you come across, might be easier this way. This is a Celebrate report on Lindsay's phone, right? Now, I understand that you might not have been standing next to another cop going through the records and documents on her phone. You're able to recognize that as being the Celebrate report, right?
It is a Celebrate report, sir.
And it's a Celebrate report for her phone. You can tell by the numbers, right? Maybe this would help a little bit. See this here where it talks about source file and it's got a number, quadruple 08110-0009255E and all the rest of them. That would be her phone, right?
I don't have that number memorized.
Of course not, but it would be in your report?
Yes, sir.
Okay. Celebrate extraction report?
It would depend on the supplemental report that you have, sir, whether or not that character was displayed.
Because this is, we agree, is Lindsay's cell phone. Celebrate extraction report.
This item you have here, sir?
No, I'm sorry, the exhibit.
This is the calendar supplemental report, yes.
For Lindsay, so what's the number? You must have a number that would connect to her phone, like an address, like your home address, but in fact, it would be a number, right?
It's a device identifier. It is not.
I am trying to moderate between the fact that Attorney Reddington will not wear a lapel mic and to try to catch him, the court is really loud. So I try to give you guys a little moment so that I don't jump scare you when I pop in. Yes, he is an expert. He is the Commonwealth's expert for the digital download of Lindsay Clancy's phone. Now, the gentleman that was on before was the digital expert for the Commonwealth, also a state trooper, but he was only there to talk about the two MacBook Pros that I believe were eventually linked to Patrick Clancy, one for his job and then one for his personal use. Uh, so yes, this is just basic. Why were you looking at this? Do you know why the Commonwealth had you looking at this? Did you look at all of these different factors? These aren't gotcha questions. He's not trying to trip him up. He's basically wondering what the heck the Commonwealth is basing a lot of their theories on.
Presented in this supplemental report.
Okay, where would the device identifier be presented?
It'd be presented in the front page of the initial extraction report.
And that's the 780,000, whatever it is, pages, right? You don't have that here. Certainly 180,000 pages. You don't have that here, right?
No, sir.
Excuse me, Your Honor. Sure. Mr. Barrow. Did you bring your report today with you? Just the report, not all the exhibits?
No, sir.
So you would agree with me, sir, that one of the concerns as an investigator that you had is things such as looking for buzzwords like suicide, right?
I'm not sure I understand the question.
When you're looking on...
How can you not ascertain why he's at... Bless your heart, sweetheart, but are you really confused by that? And if so, I am terrified that you are part of public safety. So please tell me that you just misheard. You need just a second, because if you are legitimately confused as you sit on the stand why he is asking you that particular question in this case, I feel like the person most in need of a neuropsych assessment is you. Who is the current president? What day is today? What taste is grape? You know?
The target's phone. And out of this whole courtroom, the target would be Lindsay Clancy, right?
Yes, sir.
All right. And you had access to her phone, right?
Yes, sir.
And you all went into it with a search warrant, right?
Yes, sir.
And you were looking for different topics such as suicide, drugs, killing kids, I imagine, to investigate, right? You had buzzwords.
Yes, sir.
And did you come across, for example, a search that indicates carotid artery?
I don't recall.
Did you come across a search on Safari, how to slit your throat to die?
I don't recall.
Did you come across a search, can you turn airbags off on Kia Sorento?
I don't recall.
Did you know that she had a Kia Sorento?
I did not.
If I approach you with this Celebrate report, sir, does that give you the numbers for what I just went through with these searches?
The universal device identifier is a match.
It is a match, okay.
Yes, between this document in my hand and the ones that you're holding.
So would you agree, what's the first search on the first box?
The value associated with the source file is carotid artery.
And the next box.
How to slit your throat to die.
And the next box.
Can you turn airbags off on Kia Sorento?
These all came from Lindsay's phone, right?
I can't confirm that.
Well, it's a pretty good inference, right?
Yes, sir.
Run right off of these.
If we could just
Sure.
see them at sidebar.
How in the hell? How in the hell? And Reddington, why didn't you ask? What would you say you do here? Because I feel like humanity requires this. Now, again, I am confused here, but the Commonwealth said that this man was the expert in um cell phonology, and then he's like, I can neither confirm or deny. Well, it's not the 1990s, and we're not asking you to don't ask, don't tell. We really don't care anymore. What we were asking is if you were asked to testify, you were asked to find this stuff out, and then you have no memory of it. What in the name of giblets in a handbasket is going on here?
Thank you. And just, thanks. And if I can, for continuity, sir, looking at what has been marked as Exhibit R, S, and T for identification, not an exhibit yet, the jury would have, but nevertheless, we can question you about it. You do agree with me that the phone identifier numbers are listed here, and they're pretty much the same on these three exhibits, right?
Yes, sir.
Okay. And that would be Lindsay Clancy's phone, right?
I can't confirm that. Yes, sir.
So I've just handed you Exhibit 237, sir. Can you tell me what that exhibit is? The district attorney questioned you about it.
It's a supplemental report that I compiled from the Celebrate software on the calendar application.
Do you have access to what was referred to as the mummy text messages?
Not with this document, sir.
So that document is the calendar that we had already gone through as far as seeing the doctor 9:45 and 10 o'clock appointments, right?
That's correct.
Sorry. Is
Exhibit 238.
Case in point, she is not a pastel. You are not a spring, ma'am. Stop trying to make spring happen. You are an autumn. You are a white snake. You are a barracuda, from heart. You are not a Laura Ashley. Look, it took me a long time to realize I too was not a Laura Ashley. I'm more of a Maleficent. But once you make peace with it, you can look fab. Okay. So just make peace with it. Go home and look, I would donate or burn all pastels, but that's do what makes you feel fabulous. Donation is probably better for humanity, but there you go.
Exhibit 238, sir, if I may. On the exhibit, sir, this would be captioned the mummy text message thread between Lindsay and her mother. Is that fair to say?
For January of 2023, sir, yes.
Okay, so this search was limited by the police to January of 2023 for the texts between Lindsay and her mother, right?
Correct, sir. It's a filtered supplemental report from Celebrate.
Filtered supplemental report, okay. So who would be, when the jury's looking at these in the jury room, who would be the blue texter? Would it be Lindsay or her mother?
You could just look at the participant delivered status sent from Lindsay owner to mommy. So the green would be from the owner of the phone to the recipient mommy.
Okay, so green would be Lindsay, blue would be the mother.
That's correct.
All right. Now, let me give you exhibit 238 and just a representative example. I mean, looking through, will you look at September 28th at 6:18 in the morning?
Sir, can you repeat that date?
Yeah, sure. September 28th. Oh, you didn't do, that's right, you didn't do September. You only did January, right?
Sir, this exhibit is just for January of 2023.
Okay, I apologize. Let's jump to January then. Now, let's say January 3rd.
And that right there was masterful. Now, it was subtle, but if you are keyed into subtle, kind of persuasive techniques, what Reddington did there was masterful. He pointed out without, going out and naming that the Commonwealth cherry-picked, that they had access to every single conversation between Lindsay Clancy and her mother and various people in her life. And they had to go digging for the ones that, and cherry picking the ones that, showcased any bit of a semblance of a view that fit their story, their narrative. So what he did there was masterful because he knew already that he didn't have, the paper that they had. He knows this is a supplemental report. He is not stupid. What he is doing there is subtly highlighting that the Commonwealth had no interest in actually figuring out what happened here. They were very, very intensely invested in finding the bits and pieces that could be hammered into their narrative. And it's subtle and it's not beating you over the head, but it's the kind of thing that is masterful. And I don't know if it can be taught, but I hope that law schools are adding, viewing of these very masterful courtroom attorneys and having someone break down exactly how this translates to jurors, because I think there is a big gap there between, what attorneys are given as far as a legal education and then what they're given as an optics education.
8:35 in the morning. Do you have that?
One moment, sir.
Sure.
Yes, sir.
And what did Lindsay say to her mother on January 3rd at 8:35 in the morning?
At 59 seconds, sir.
Yeah.
I'm all right, period. Anxious about meeting with the whole psychiatry team.
How about the next message that she sent at January 3rd at 8:37 in the morning?
In 31 seconds.
Sure.
I'm just worried they won't send me home soon.
Now, do you know, as a police officer working on this case, what she meant, send me home? Do you know where she was on January 3rd?
It would be an inference only, sir.
That's all right. You can infer.
I believe she was in a medical facility.
McLean Hospital.
I recall that calls were being mentioned.
And then on January 8th, sir, at 10:44 in the morning, was there a text from her mother to Lindsay, if you know? 10:44. Where the mother asked you, did you sleep good?
1 second, sir. It's cut off by the clip here. 10:44 and 30 seconds a.m.
Yeah.
From mommy to Lindsay. Great. That will be fun. Sleep good last night, question mark.
And did she respond? She meaning Lindsay?
She did.
What'd she say?
I actually did.
And this was on January 8th, sir?
That's correct.
January 10th, could you pull that up, please, at 9:48 in the morning?
I think that he has less of a bone to pick with this particular gentleman, and while it does appear that he seems to have a bone to pick with women, I think he would have been just as hard as any male clinician involved in Lindsay's mental health. I think that, I think he could be perceived as having a problem with women, but I think that's more of a factor of the last few witnesses that he has had to be, very confrontational with have been the mental health care providers that were letting Lindsay down, I think, by any estimation. And I think that you would have noticed the same level of aggression and disdain towards them had they been male. But I see how it could be perceived like that, and I'll be paying attention to it. But, I didn't see it like that, but I see how it could be perceived like that, and I will keep an eye out for it because I do like to call balls and strikes. But to me, it just came off more as a factor of he was faced with incompetent women, and he would have been just as irritated with incompetent men.
I apologize, sir. Can you repeat the time on the
Sure.
10th?
9:48 in the morning, beginning with mother asking questions of Lindsay. Still sleeping good, question mark.
I have a message at 9:48 and 15 seconds from mommy to Lindsay.
Okay, what is that?
Good morning. How are you doing today? Question mark.
And what did she say in response?
Good. Period. At the gym with the kids.
And what was the date? Was that January 10th?
2023, 9:48, 21 seconds a.m.
So do you have January 10th in front of you, not the 23rd?
Okay, my correction, sir. January 10th, 2023 at 9:48 and 21 seconds.
All right. And what did the mother ask her?
Nice, still sleeping good.
Did she ask her, are you feeling better during the day? And she said, so far, a little bit.
Would you like me to read that, sir?
Yeah.
At January 10th, 2023, 9:53:01 seconds a.m. Are you feeling any better during the day? From mommy to Lindsay.
And go to January 12th, 11:09 in the morning.
Yes, sir.
What did she say? What did mommy say?
From mommy to Lindsay, January 12th, 2023, 11:09, 32 seconds a.m. Still feeling a little better, question mark.
And how did she respond? How did Lindsay respond?
A little bit.
And then on January 16th, well, wait a minute. January 14th at 1:05, I think in the afternoon. Can you pull that one up?
Yes, sir. One moment.
Okay. You recall where it starts as, I'm waiting for the day. And that would be from Lindsay to her mother.
Can you repeat the time one more time, sir?
1:05
AM or PM?
PM.
And this is on the 14th, sir?
Yes, sir. Yep. January 14th.
I have a message from Lindsay to mommy, January 14th, 2023, 1:05, 13 seconds PM.
Saying?
About the same, period, hanging in there and waiting for the day I wake up and feel me.
So she says, waiting for the day I wake up feeling like me, right?
That's correct, sir.
Okay. And then On the 16th of January, if you can pull that one up. January 16th at 10:20.
I have a message from Lindsay to mommy, January 16th, 2023, 10:20, 24 seconds a.m.
And what did it say?
It was fun, period, period, period. Cora and Dawson enjoyed, period, period, period.
Now, did it make reference at any point in the text that that was a reference to the Cape Codder? Is that in there at all? Do you see it? It was fun, referring to what was fun, if you know.
Not in this particular message, sir.
Okay. And then continuing on, sir, January 18th, would you agree that she inquired of her mother, or the mother asked, are you starting a new med? She said, I did. I started it two nights ago. And that basically the mother was asking her about her medications and how she felt and how she was doing, right?
One moment, sir. I just have to get to that point.
You know what, that's okay, because it's an exhibit and the jurors are going to have it and they can take a look at it. So that's okay. We're good on that.
Okay, don't answer the question.
No, you don't have to answer it. That's all right.
Okay, sir.
Now, on January 24th, District Attorney asked you about the Google searches, Googling 3V restaurant, looking at the distance from the house to 3V restaurant, looking up menus. You recall answering her questions on that?
I do, sir.
And you're familiar also, prior to that, on the same day, that she had taken the baby to a doctor and that Pat texted her and asked basically, you know, how did it work out? Do you recall that?
I recall the doctor's appointment. I don't recall the text.
Do you recall that Lindsay sent a picture of her and her children taken that afternoon?
I recall the snowman photo.
I'm sorry?
I recall the snowman photo.
Okay. And that was on the 24th of January, right?
It was, sir.
Do you recall that Pat texted back and said something like, oh, wow, you're a good mom? Call that?
I don't recall the text.
One of the other searches that you did would be, are you aware that there were searches for medical, such as questions regarding bipolar symptoms, psychosis? Can you be in DKA without high blood sugar? Page after page after page, trazodone, what is the effect of trazodone? Wellbutrin, how do you feel on trazodone? Ativan addiction, Prozac, Trazone, going on and on and on. You guys saw this on her search on her phone, the Celebrate, right?
I recall those searches, sir.
Okay. Could I offer this, Your Honor? This would be medical searches on her phone.
Any objection?
No.
All right, that may be admitted.
Exhibit 239.
Great, thank you.
Do you recall, sir, that there was also a search for schizophrenia? I'll say that.
Not specifically.
Well, if I approach you, sir, and your extraction report, does that refresh your memory that there would be a search on her phone for schizophrenia? See where it says schizophrenia?
Yes, sir.
Okay, what was the date of that search?
January 19th, 2023, 9:58:01 seconds a.m.
How about psychosis? Did she search for psychosis as well?
If I may. There is a keyword search in psychosis in a Google search.
And that would be a keyword search, as you said, in a Google search on the January 20th.
January 20th, 2023, 8:39 and 0 seconds p.m.
Okay. Then is there also a search for Seroquel?
Seroquel is part of a search, yes.
And what was the rest of the search?
On Seroquel, feel like I can't have a conversation.
Okay. And it goes on a number of other inquiries as well, correct? Dealing with Seroquel.
That's correct, sir.
And then further, do you recall that there were a number of pages where she Googled and was inquiring about suicide?
Yes, sir.
And can you tell us when she was Googling suicide?
December 29th, 2022, 1:02:14 seconds p.m.
And would you agree that she also Googled on a number of occasions sleep?
Sleep is one keyword and part of a Google search, correct?
And then there's a number of pages that are attached to that dealing with the search for sleep, correct?
That's correct, sir.
And do you know the time frame that we're talking about from the Celebrate search?
Multiple entries, sir. Majority of them are in January of 2023.
Okay. Also, a much larger package of searches for trazodone. Is that correct?
Yes, sir. Trazodone is one keyword as part of multiple Google searches.
Zoloft?
Correct.
What's the time frame?
If I may just remove this, sir.
Yeah, sure.
Earliest entry is December 31st, 2022, 4:07:48 seconds p.m. Last entry, all on the same date, December 31st.
Who struggles to always understand the motivations or perspectives of other people. What is the point of this Commonwealth? You know, you told us at the beginning of this case, and my head cannot take the bow any longer. I love my bows of discontent, but they hurt my head. So what is your story here? Like I I am genuinely struggling. You told me at the start, at your opening statements, that you were going to pull the veil off of our eyes, that this unwarranted sympathy was a, fig Newton of our mass hormonal empathy or what have you, and that we were all going to be, exposed to this, pay no attention to the woman in the wheelchair. We were going to be exposed to the true evil, Nellie Olson-esque woman that Lindsay Clancy is, was, and always shall be. But instead, at every point, we are being shown that this was a woman screaming out for help and being ignored because she didn't have a plan. So what are we doing here? And welcome, Broken Baker Raiders. I am, for the 11th million time, even with my semi cloak of smartness, shielding me from the unrelenting dumb of the Commonwealth. I am still here for the 11th time, trying to ascertain what the hell the Commonwealth is trying to tell us, where they are going with this case, and what the hell is going on, basically. We have entered the hell dimension. We are in the Celebrate hell. Now, I have already reached out or am attempting to reach out to the legal profession on YouTube, because I am pretty sure that I have a legitimate class action lawsuit against the Commonwealth of Massachusetts for the emotional and physical pain that they caused me in the 2, count 'em, 1, 2 dose Karen Reed trials, where they subjected me to multiple witnesses who have no idea what and did not clarify anything. So, if I do have a legitimate claim against the Commonwealth of Massachusetts, that would put third a third-party interlocutory appeal on any more Cellbrite information being brought by the Commonwealth of Massachusetts until they are able to understand that with great power comes great responsibility. Please reach out to me. My inbox is mointhedeepend@gmail.com. I look forward to working with you all. I will be a great client. Yes, I will show up in a cloak. Look, just deal with it. Normal is overrated. But I can't claim that I would really be a good witness, because if the Commonwealth asks me dumb questions, they will get dumb answers in response, but I can promise that the transcript will be hysterical. Contact me, guys. Anywho, we are back to, and thank you, Jay Potts, for the jewels. I finally accepted jewels, guys, and gifts. I didn't realize there was a little doohickey I had to combobble. And if you missed it, you guys, now, Baker, maybe you can be my help for this. I'd like you to be introduced to the trauma tourist Bo. Now, I have modeled this on my favorite unintentional comedian, Jess Machado, and a hint, a sprinkling, an Emerald Lagasse bam of hidden true crime. I captured the eyebrows of Journalism Inc., the glasses, the penny problem, I'm serious glasses, and the eyes move so they can see everything and nothing at the same time. I also have tickets to the movie theater, because this isn't a trial that involves human tragedy. No, it is a show for me. And then um, a mirror, so that this particular Bo, she can look fabulous as she's doing it. Now, this is beta testing, but trauma tour. The bows of our discontent have been awesome art therapy, and since we don't have court tomorrow, I will be attempting my first ever live stream. I rarely pimp myself out, but I have a secondary craft channel called Mo in the Craft End, and we will be attempting the possibly the Canton bow, or some other bow. I think the Frye bow that I will be debuting on FNL. So be there or be square. Now, it'll be closer to the afternoon because I have an irrational fear of technology, and I will be working with a new wireless headset. So I will be internally panic spiraling until the afternoon to make sure everything is going okay. But that's my general plan for tomorrow. Now back to the trial. Sorry, you guys. Not great at the scripting thing, but definitely excited about the bows. Look, this trial is god awful, and I don't know why I continue to pick out these god awful trials. But finding an outlet that makes me smile and can mock people at the same time, Snarks and Craft Therapy will commence tomorrow, is all.
2022, 7:06, 39 seconds PM.
Okay. She also, on her phone, is a search for benzo withdrawals, right?
Yes, sir. Benzo is listed as a keyword as part of another search.
Also, after benzo, it says withdrawals, right?
Correct.
And what's the time frame for that, please?
January 20th, 2023, 8:11:57 seconds PM.
And
Okay, also another thing, withdrawals kills me. I love the way that words sound, and I often repeat them because they're but how can you make withdrawals, which is a relatively uncomplicated word to say, withdrawals? Like, it's physically harder to say, to add the R in there. I don't know, but that's always cracked me up. My father is from New England, and I have often asked him the same question, so uh, Reddington, I just love you, but it is physically harder and involves more work to say it the way you are saying it.
Also a search for Wellbutrin.
Yes, sir. Wellbutrin is a keyword as part of a Google search.
Does it say what the time frame is?
It does.
What is it?
January 16th, 2023, 9:14, 47 seconds a.m.
And a search for McLean.
Correct, sir. McLean is part of a keyword of a Google search.
What's the time frame?
December 29th, 2022, 8:52, 37 seconds a.m.
Is there also a search for insomnia?
Yes, sir. Insomnia is part of a keyword of a Google search.
What's the time frame?
December 31st, 2022, 7:12, 58 seconds p.m.
That's December 21st, did you say? 30.
December 31st, 2022, sir.
And there is a search for keyword ketamine. Ketamine.
Yes, sir. Ketamine is part of a Google search. It's a keyword within the Google search.
What's the time frame?
For this entry,
Now, I do want to say that I know that ketamine does get a bad rap. And look, I am not a doctor, I am not a doctorologist. I can only say that I have personally done infusions, and because it is not covered by insurance, there while infusions have shown to be actually helpful for mental health issues that are SSRI resistant, um, I can understand why the Commonwealth is using it as a cudgel. It is a scary sort of thing. It does have a lot of sort of recreational connotation, but it is not out of left field. A lot of mental health professionals are coming to understand that infusions and interesting, what you call it, interesting benefits for people who have not been able to receive help from other medications. They have received mental health help from ketamine. So I understand why the Commonwealth is using it, but there has been clinical research, and there are promising research and trials, and even generalized use in the understanding that there are benefits to this under a licensed, physician, healthcare team, and things like that.
January 20th, 2023, 8:39, 0 seconds p.m.
So also a search pulled up on Celebrate for Lamictal.
Yes, the word Lamictal was part of a Google search.
And what's the time frame?
January 16th, 2023, 9:23, 13 seconds a.m.
Is there also a keyword search for postpartum and Google searches for postpartum depression and various aspects of postpartum?
Yes, sir.
And what's the time frame for it?
They all occur within January of 2023, with the earliest date being the 11th of January 2023 and proceeding all the way to the 19th of January 2023.
And keyword benzo. Is that on the Celebrate report for Lindsay's cell phone?
It is, sir.
Can you tell us what the time frame is?
Sir, would you like it for the first entry or all the entries?
Give me the idea, like, bracket, starting on when, ending on when. We don't have to go through all of them.
The earliest entry appears to be December 6th, 2022, 9:17:05 seconds AM, with the last entry being January 20th, 2023, 8:13:48 seconds PM.
And search for bipolar. That was on her phone.
Keyword bipolar is part of a Google search, correct?
Bracketed in. What's the time that it started? When did it end?
The earliest entry is from this report is December 29th, 2022, 9 AM, 37 seconds. And the last.
And again, Reddington is masterful at this because the Commonwealth relies on cherry picking, and Reddington goes in and demystifies all of this by going through and making them go through one by one all of the searches they did, everything that proves that Lindsay wasn't just out of thin air searching these things to create a narrative, that these were constant searches, that these were searches that started before their little search windows, and that they were only picking out parts of the supplemental report that they could hammer into their narrative. And again, if I am a juror at this point in the trial, even if I do not like Lindsay, I am waiting for Attorney Reddington to bring out all the facts and bring out the truth. As a, intelligent human being, I understand that he's going to bring out the facts in a way that are best for his client, but he seems to be the only one that's bringing out, the facts, good, bad, and ugly, and he's not objecting. He's saying, okay, bring it in. I don't have any problems with bringing in the facts. So in 13 days, he's demonstrated that if I were on the jury, I'm waiting for him for his opinions. I'm waiting for him to make any of this make sense, because I do not trust the Commonwealth. And that is an incredibly dangerous place for you to be if most of the court of public opinion, even the odd side, is against you.
Last entry is January 13th, 2023, 1:38:42 seconds PM.
And clonazepam was a search as well, correct?
That's correct, sir.
And can you just give me an idea, what's the time frame on that?
All of the searches in this report indicate January 18th, 2023, in the morning hours from 11:26 AM to 11:27 AM.
Okay. And the next one would be Ativan. You see where it says Ativan? What's the first? Just give me the first month. What's the stat? Search for Ativan.
The earliest time frame, sir? December 31st, 2022, 7:06:30 seconds PM.
Okay. Next one would be amitriptyline, correct?
I'm not sure on the pronunciation, but it appears to be that way.
Okay. And when was the amitriptyline search? When did it start? When did it end?
January 16th, 2023, 11:01:28 seconds AM, with the last entry being January 23rd, 2023, 8:17:58 seconds PM.
And then on January 20th, 2023, was she searching intrusive?
That's correct.
Okay. And then finally, sir, on January 19th of 2023, was she searching hallucinations?
Yes, sir. 10:33:49 seconds AM.
Sir, I would offer these.
I could just look them over.
Sure, yeah.
You're welcome, sir.
Oh, Agatha, don't drink water near the mic. Yes, free the First Amendment. We basically just sped right through it and went into the next day. The Commonwealth can choose to can run their case however they like, and I will run my channel however I like. And I will not be part to third party emotional boarding that serves no purpose in the logic of any sort of trial strategy. I've already heard the cries of a mom who's lost a child in real life, and I don't need to hear them again. Oh, maybe it's the judge.
No objection.
Okay, those may be admitted. Do you want to admit it's individual?
Is one individual or all one? I don't care.
Why don't we do that? I hate to do this to you. Why don't we do it individually? Just might be easier down the road.
Okay. I apologize. I neglected to ask about this.
Thank you for your
celebrated
concern.
report from Lindsay's phone. This is really my another extraction search on her phone.
Yes, sir. It's a supplemental report for searched items.
And looking at that, Ken, basically there are a number of search terms in there, such as pre-made goodie bags, and that would have been on December 31st. Is that right?
Yes, sir.
All right. And what's the next one underneath that would be on December 31st?
Child with bloated belly and lethargy.
How about the next one on December 31st?
Children's Motrin stores.
What about the next one on the 31st?
Children's Motrin.
Next one.
Is children's Tylenol the same as infants?
Next one.
6-month-old whale windows.
That would be WALE, whatever that means.
Yes, sir.
6-month-old. Okay. Next one.
Earth's Best Organic Baby Food.
Next one.
Earth's Best Organic Infant.
Next one.
Earth's Best Organic Infant Formula.
Next one.
Nova Plymouth NOVA.
Next one.
Best Kids Movies.
Next one.
Nova Trampoline Lark.
Next one.
Unicorn Picture.
Next one, if you can.
Yes, sir. Unicorn Picture Free Coloring.
Just read them right down.
Yes, sir.
Just rip right through it.
Paw Patrol saves. I'll spell it. Paw Patrol saves the MEREKR. Twin Girls Bed. Cape Cod Resort. How much formula for 8 MINTH? Chuck E. Cheese. Chuck E. Cheese. Children's Motrin. Children's Motrin stores. ADC Temple Touch Thermometer.
Can I just interrupt you?
Yes,
What do we
sir.
have to for date right now?
The last item I read was ADC.
This is also something that you can't teach, but again, it's just and it might be his basic human makeup, but he kind of taps him. So he taps him, he waits for the trooper to orient himself back into a space where he's accounting for Reddington, and then he asks his question. So, while we have seen different sides of Attorney Reddington from, grumpy to exasperated, he's actually a very good communicator and on many different levels from the conscious to the subconscious. So if I were the Commonwealth, I'd be terrified because he can build rapport with these witnesses very easily. And I think it's just his genuine makeup, but I do think that it is something that could become someone's kind of way of interacting with witnesses. He just naturally seems to build a rapport. Yes, these are all things that she looked up on the day of the incident. So it started out with child bloating and issues like that, and then I think went directly into is infants and children's Tylenol similar? Then went to look up Chuck E. Cheese's Paw Patrol, kind of things like that. So basically, what Reddington is doing is asking him to go through everything that Lindsay searched that the Commonwealth was able to find from her phone from the day of the incident.
Can I just interrupt you?
Yes,
What
sir.
do we have to for date right now?
The last item I read was ADC Temple Touch Thermometer, sir, and the date was January 17th, 2023, time 2:19.
I'm sorry. I think it's the week. I apologize. I misread the time kind of but it was right in the very short time period before the incident where these 3 precious children were lost.
03 seconds PM.
Okay, I just want to get a frame on the time. Okay,
Yes, sir.
go ahead, finish that up.
8-month milestones. Fluffy slime recipe. Fluffy slime recipe. UTI symptoms children. Kids Miralax. Miralax for kids.
And what was the date on that?
The last date on the page for Miralax for kids, January 24th, 2023, 4:47:31 seconds PM.
Yeah, go ahead, finish these 3 more.
Yes, sir. CVS Pharmacy, Pedialax, Pedialax.
Thank you, sir. I'd offer this, Judge.
All right, that may be admitted. Yeah, 261. That's
And then finally, sir, approaching you with what would be a report. You can recognize that document, right?
Yes, sir.
All right. And what is that? It doesn't have the thing, the header on the top. That's all.
It's a supplemental report, sir, and appears to be text messages.
Are you able to know when the photograph of the 2 kids and the snowman was sent to Pat by Lindsay? You know when? Was it on the 24th? If you know.
I would have to look at the extraction.
So, understanding jury would be able to be looking at the photo and has a little history. If we look at this report, you see where it says Lindsay owner, and then over here, it says Cutie.
Yes, sir.
So is that from Pat to Lindsay?
That's correct.
And what's the date and the time?
January 24th, 2023, 8:19:45 seconds AM.
Okay. And what's the next one that you see? And just say to us, like, it's Pat to Lindsay or Lindsay to Pat, and what is the message? You don't have to go through all the numbers.
Yes, sir. Next item, do you want me to read the date, sir?
Yeah, sure.
Next item, January 24th, 2023, 8:36:17 seconds AM. Lindsay to Pat, loved an image, which is a reflection that someone use the feature within iMessage to like an image.
Like an image, like a photograph, right?
Correct, sir.
Yep. What else?
Want me to keep going?
Sure.
January 24th, 2023, 8:42, 16 seconds a.m. From Patrick to Lindsay. How's it going?
And you know what? If it's the same date, rather than taking the time, just go right down and read the messages. That would
Received, sir.
The time frame.
The date is the same for all the messages. From Patrick to Lindsay, how's it going? Lindsay to Patrick, good. Lindsay to Patrick, okay, her urine looked good, so nothing going wrong with her kidneys, phew. Patrick to Lindsay, good, with a smiley face. Lindsay to Patrick, no message content. Patrick to Lindsay, oh wow. Patrick to Lindsay, you're a good mama. Lindsay to Patrick, smiley face with hearts. Lindsay to Patrick, blank. Patrick to Lindsay, laughed at an image. Lindsay to Patrick, any chance you want to do takeout from 3V, period, period, period. I didn't cook anything, period, period, period. It's been a long day. Smiley face. Patrick to Lindsay, yeah, smiley face. Lindsay to Patrick, okie dokie, smiley face.
Okay. I'd offer that, Your Honor. Thank you.
Yes, sir.
Your Honor, these text messages are already in evidence as Exhibit 23.
I'll allow that. Come on.
Finally, District Attorney spent some time asking you about modifications to a photograph, and I think it was of the little baby. You recall that line of questioning?
Yes, sir.
What did that mean? Does that mean that someone, or Lindsay or someone on her phone, changed the photograph of the little baby? Is that what that means?
It means that the photo was edited in some fashion.
So that could be like coloring?
It could be a variety of things.
Like what?
As I indicated in my earlier testimony, it could be that someone took a live photo, and instead of having it be a live photo, which is a multiple burst of images, they took it down to just a single photo.
Anything else that can be modified?
Multiple things, but from the extraction, that's the only thing I was able to determine.
So you weren't involved in the search of the Clancy house on the 24th, 25th, right?
No, sir.
Were you aware that there are photographs of the kids hanging in virtually every room, kitchen, living room, bedrooms? Do you know that as an investigator on this case?
Sir, I was not involved in the search.
You know that there were dozens and dozens of photograph albums, little babies, all over the house. Do you know that?
I was not aware of that, sir.
Thank you.
Commonwealth redirect.
All of the exhibits that
Everything the defense just told you was bullshit. Ma'am, those powers don't work for the Sith.
that defense counsel just put in about the searches for psychosis or certain drugs, are those all available in the disc Exhibit 236?
What the hell is this? This is not an own. You'd have been better just sitting down. You'd have been better just sitting down and being like, nope, nothing else. No, you're like, but we showed you that we're functionally stupid and picked out the dumbest things for our argument. The defense pointing it out is mean.
In some of those reports where you can search the word and all of those mentions will come up.
Yes.
Sir, on Exhibit 258. Thank you. The search is about psychosis. Some of those searches were for psychosis symptoms on January 19, 2023. Is that correct?
What is the point you're trying to make? No, She searched symptoms of psychosis, not do I have psychosis. Therefore, total fakery. Ma'am, sit the hell down. Look, I say this as a person who's not even on your side, but who is suffering from a level of secondhand cringe embarrassment for humanity that look, his face says it for you. Ma'am, look at your witness's face. I believe this says it all. God. Mandy, I did have a bow on. It is my Mr. Mo has to do construction. Damn. Okay. It is my trauma vulture bow. I did put it on X, but it was bothering my head and the intake of stupid. So it's just you guys, even with my semi-protective cloak against ignorance, I simply I'm trying to follow my favorite YouTuber by having just unrelenting fart sounds in the background. I wish I could take gastric credit for these, but no, it's a power drill.
That's correct.
The person using the phone looking it up was looking up to find out what the symptoms.
Valhalla, I am in no way that fortunate. This is a hoodie that is way too big that I have used as a makeshift cloak because Mr. Mo says that I have used my budget for bow crafting and cannot I cannot justify a cloak right now. So when life gives me lemons and Mr. Mo says no to my budget, damn it, all the hell, Mr. Mo.
Someone would be experiencing if they had psychosis, correct?
It's a keyword search for psychosis symptoms.
You were asked some questions about the chats between Lindsay and her mother in Exhibit 238. Correct?
Yes, ma'am.
There's a text message from
Dear Lord, the physical pain I get from watching this woman trying to figure out her case in real time. It's like watching a dog trying to do algebra, or hell, me trying to do algebra. The physical discomfort that I know Mr. Mo has when I'm trying to do technology and it's like a dog doing algebra. This is physically painful to watch. Why isn't the elected DA like coming in and saying, "You know what? I'm gonna take over. You guys, wow, whew, you look really bless your heart out there." Well, yeah, I mean, like I said, the secondhand cringe embarrassment is real.
her mother to Lindsay on January 19th, 2023, which states, "I'll bring it Saturday. Never know what treasures I'll find in the attic," correct?
That's correct, ma'am.
Seeming to indicate that her mother is going to visit her that Saturday, correct? From the text message content.
It's an inference.
Is there also a text message?
At the risk of sounding like Adam Sandler from The Wedding Singer, But the fact that I feel the need to quote Adam Sandler from The Wedding Singer, that I feel like all of this preparation could have been done yesterday. You know, again, watching you try to amalgamate a thought is painful for some of us. Please, please don't do it in public on national television. Dear God.
From Lindsay's mother to Lindsay on January 22nd, which would have, 2023, which would have been the Sunday after the Saturday visit, in which her mother says, enjoyed seeing everyone this weekend. Nice to see you doing better.
Wait, okay, maybe I need to method act to get in the frame of mind. All right. I thought I was going to have to save this for closing, but maybe I need to be as close to the bow as humanly possible. Maybe with the gravitation of the comically large bow, this will make any possibility of a frame of reference of sense. So, Commonwealth, are you legitimately trying to suppose that because the mother thought that Lindsay was doing better a month before the incident, Lindsay is faking? I just need to know, do you have a jump to conclusions, Matt? Have you met with the Bobs? What would you say you do here? I have never in my life wanted to cuddle next to a TPS report to make things make sense, but you have me wanting to have a TPS report to get comfort. Okay? I what in the Bobs is going on here? Damn it, Mr. Mo.
Correct.
I have nothing further.
Straighten.
Just very briefly, kind of like a housekeeping thing, if I could, Judge. I'm approaching you with,
Wait, we need to go back because, okay, you need to now the cameraman did not catch it on this particular stream, but Reddington just casually walks by the Commonwealth's table, picks up one of their exhibits and walks to the witness. Is there any is there any question why we love this man?
I have nothing further.
Straighten.
just very briefly, kind of like a housekeeping thing, if I could, Judge. I'm approaching you with text messages. Would you agree with me? Again, this came up on Lindsay's phone, and it would be text messages between Patrick, Clancy, and Lindsay. Kind of flip through them all. Trust me, one of the others.
Yes, sir. That's correct, sir.
Okay. And then finally, I'm handing you again extractions from Lindsay's phone that you can flip through them if you wish. Would be between Lindsay and Sue Clancy, her mother-in-law, Patrick's mother. It says Sue Clancy.
That's correct, sir.
Okay. I'd offer these to you, Your Honor.
Objection.
If I can see counsel sidebar.
Okay.
Thank you.
Yes, we are on today and very close to
All right.
being on track.
It's 1 o'clock, so 1:01, so they'll hold that against me. So we're gonna take the afternoon recess at this point. I'm gonna ask you to be ready to come back 2 o'clock in the next witness. My instructions are the same. During the break, don't talk about this case, don't do research, don't read anything, don't listen to anything. And then see you back here about 2 o'clock. Okay, thank you.
Court, all rise. Judge, kindly close the notebooks. Place them on the chairs, please. This way, please.
All righty. Now, they did say something about possibly ending early today, so I'll just keep it on me. So if you have missed kind of today and you came in a little behind, we've had a lot of digital forensic information. Now, what exactly the Commonwealth believes they have showed us and what has been shown um, is available for interpretation. Let me go back because I'm having basically, the problem with the Commonwealth is every witness that they've had on the stand today has been unmemorable, except for the fact that they're kind of interesting looking, or at least they follow the trooper sort of phenotype, or at least a visual model. They all seem to have an NPC sort of build kit that they kind of start with. But the first witness was a digital forensic trooperologist that went over Patrick Clancy's laptop. Now, these two laptops were identified as Patrick Clancy's. They came from his office area in the basement, and the defense has not really argued that. But in the forensic search of those two laptops, I can't remember if it was on the personal or the business, though I do believe it was personal, but don't quote me on that. Uh, During the search of the personal laptop, there was a search around, I believe, September or December or November-ish for deletion, self-deletion on Patrick's laptop. Well, according to Patrick's own testimony, because he was asked about this both by the Commonwealth and the defense, and according to Patrick, he was the one that made those searches about self-deletions or self-deletion in regards to a popular musical artist that had unfortunately taken his own life. So not only is it confusing to me as to why the Commonwealth compounded that kind of uh, non-evidence that they had, because Patrick admitted to being the one that did this search and the subsequent searches on the stand, but they brought in an expert from the Massachusetts State Trooper's Office to kind of break down all of the Cellbrite or whatever computerology program they use for that. So he broke that down, and Reddington was very uh, easily able to say, were you able to ascertain that this was Patrick Clancy's laptop? Were you able to ever, find anything that would prove that Lindsay Clancy made these searches? Well, not only could they not find that, but Lindsay Clancy was out at a doctor's appointment with a young child. Now, while the Commonwealth did put out there that the children's pediatrician was only 3 minutes away from the Clancy home, Patrick already admitted to being the one to creating these searches. So why we're bringing on an expert to go over that, I don't know. The next witness was then this frosted tip guy, this peroxide guy, and he basically was the qualified state trooperologist of Cellbrite information. Now, we kind of skipped through the Commonwealth's testimony or direct on that one because I still have a bone to pick with Canton. My thinky bits have not yet recovered from the 2 dose exposures of your cavalcade of witnesses that have failed to make House Long to Die in Cold and how that appeared and when that appeared makes sense to me. And look, Granted, I am not the smartest Cheeto in the package, and I never claimed to be. But between 17 witnesses and 2 trials, I should at least understand how House Long to Die in Cold ended up, jumping magically into saying it was done at whatever AM it was supposed to do versus the time it magically was supposed to be. I do not understand, and I am pretty sure that I have a pretty actionable class action lawsuit for mental distress, for, the Commonwealth's previous presentations of Cellbrite information. And while that is somewhat a joke, it is also not. Had I known Cellbrite was in any way gonna be in a part of this case, I would have run screaming for the hills. Now, that being said, I do think that Reddington did a very good job of sort of explaining and demystifying a lot of this information by going piece by piece and showing how the Commonwealth was cherry picking, by going and going through the text messages and the conversations that the Commonwealth missed. I think that he did a good job in demystifying a lot of what the Commonwealth showed as smoking guns in direct. So it has been interesting to see someone, because you can tell that, Mr. Reddington is not as comfortable with technology as maybe the Commonwealth is. Um, so this is definitely outside of his comfort zone, but you can tell that he talked to a lot of people, asked a lot of questions, and you know, isn't afraid of asking questions to kind of demystify it so that the jury can understand, basically the Commonwealth's hoodwinking, that was going on. Um, I think those are all the highlights of today. Uh, there were, several funny, backhanded compliments and different things that are already showing up on, the internet. Kevin Reddington is, look, he rubs people the wrong way sometimes, but I also found it endearing that he had a little microscope or a little magnifying glass, and he offered to let the witness have it so he could see where the Commonwealth hid their case. I don't know. I don't know if that was the purpose, but, that's what my mind made it up to be. It it is interesting. There are moments, and there were moments, this morning where I think the Commonwealth is aware of how poorly they did yesterday. Now, whether it's a function of being on, just a downhill slope, and this case being too big to kind of try to modify their approach now without it looking performative or inauthentic, I don't know. But neither of the 2 Commonwealth attorneys, basically, their snarky overconfidence is down to a 9, and it was at terminal levels of 15 yesterday. I and I didn't even watch, the medical examiner testimony, but it does seem that they have been slightly cowed. Now, I don't believe that this slightly cowed behavior is going to last long, but it is interesting to see that I think they realize just how awful. Again, there is a small yet vocal, minority that goes under every single picture, of a person making fun of a person wearing a bun or the Commonwealth that are doggedly defending these 2. But it is an ever decreasing, vanishingly small vocal minority who thinks that these women are putting on a competent case. So I think they are finally becoming aware how incredibly botched, they have done. They would have been better served had they, in my opinion, followed Reddington's, pleas of stipulating and letting this be a battle of the experts. because you can get a little bit snarky, you can get a little bit snippy with an expert if you believe that they're trying to blow smoke up the jury's ass. But what you shouldn't do is get snarky or snippy with the father of the victims, the first responders, the friends, and kind of acquaintances of the defendant and the victim or the father of the victims. They've been incredibly, incredibly poor in their focus of their derision. Now, would it I still don't think it would have been a good look, but had they focused their derision solely on Lindsay and not Patrick and not everyone else, I think that this would have been not so bad a look for them. But because they so misread the room and so incredibly misread the room in their arrogance, they are stuck with what they are doing right now. And I don't know that there's even a way that you could sort of shift gears and present a softer case at this point. Um, Everything is fine over here. I will have to try. I don't think I'll ever try to watch that, to be honest with you, but I say this objectively as a person who has spent the last 5 years, um, hyper focusing on trials. And what I can tell you is that I saw a less shambolic presentation of a case with Daryl Brooks, and I am almost not being hyperbolic here. I really am almost not being hyperbolic in my statement that Daryl Brooks put on a more cogent case. Because they were about the same, publicity-wise, horror-wise, and everything else. I mean, at least he had a singular theory, which is we don't know why God let this happen, as moronic as it was. It was a singular stupid theory, not throw multiple stupid theories at the wall and hope one sticks. He at least stuck with a singular stupid theory, which, he did have little mini, like Ford did it, kind of sub theories, but we're all under the same general umbrella of God let this happen, not I, Daryl Brooks, did this, which is an interesting way to perceive any situation. But I honestly don't know where the Commonwealth is going with this, and I am shocked that there is uh even a infinitesimal amount of people still on her side. Again, even for a purely strategic, point, I I would not I would be pissed off at the Commonwealth if I thought Lindsay deserved to go to prison. If I were on the Lindsay is evil side, I would be one of the loudest, mockers of the Commonwealth because they have turned this case into an utter mockery. There is showing whatever she's trying to show with the bows, but the minute it turns into a distraction, the minute it takes attention off of the case and puts it onto myself, I am taking that bow off. The minute that, the way I'm presenting the case is becoming more of a story than the case I'm presenting, I am going home and evaluating because I should not be a part of this of the coverage of this, and if I have made myself a spectacle to the point where I am part of the coverage of this as a professional, as a, assistant DA, then I am going home and rethinking myself because this is not the look that I should want to give as a professional regardless of feelings for the victims. And that's kind of where I stand on that. So, again, I know I already am gonna have a bajillion people upset, like, "Don't mock the women that are standing up for the children. They're the only ones standing up for the children." Are you insane? 2 things can be true at the same time. We can believe that Lindsay is being overcharged and hunted down by the government and still believe that the loss of any child for any reason is a tragedy and should be honored and respected, but is not a tragedy that is going to be fixed by convicting the wrong thing, by holding the wrong thing or person responsible when there are multiple people that drop the ball here. So I can't get over the mindset where criticizing a bow is morally wrong. But, it's the internets. I never go there for a litmus test of reality, but it is an interesting world to visit. Just don't take it too serial. It's the internet. I thought we all learned this in the 90s. It's not the real world, it's the internet. Let's see. I'm hoping we can eventually get to the point where we just get to the experts in this case. I don't know if it's a function of Massachusetts, if it's just the way that these cases work, but the 2 weeks of, kind of tangential BS before we get into the real substantive point of the trial, it is exhausting. We only have 12 minutes left. I'm trying to think of things. Well, my clock is fast. Damn, that's upsetting. It is, but it is interesting and kind of scary to go over to X and see the people who, honest to God, you don't know if they're watching the same trial. And I do wanna take this time while we have a little bit of time, away. My legs are telling me that we are probably in for another storm here in the next couple hours, but if you are watching from the Midwest or anywhere that's, in basically the scary bits on, Ryan Hall or, max velocity, do be aware of, not only, storms and flash storms, but flash flooding and things like that. I know y'all are smart. I know, you're hanging out here and you have the wisdom to not drive through standing water, but a gentle reminder, because sometimes we forget that, we might have new drivers in our lives or people that we just love that we wanna remind. So, never drive through standing water, take a detour, and I speak as someone who, we are lucky enough to live in our neighborhood on high ground, but to get out of our neighborhood to anywhere is, surrounded by low-lying areas, so we are effectively stuck, when heavy rains, happen, and I've seen too many, call outs to help people because they try to go through water, and it's dangerous for not only the person trying to drive through, but for the first responders. So just I know it's gonna take extra time and there might not be a detour, but please just don't try to drive through standing water. Um, you know, if you don't have a basement or a place to get to because there are some storms that are gonna come through, look where your local, weather shelter is, public weather shelter. Just be aware, of what's going on because, the last couple days have said anything, and, with the way that both Max Velocity and Ryan Hall are talking, we do need to be pretty aware today again. Unfortunately, Mother Nature is, still just having a moment. She's just being herself all over the place for some reason. It's it's like every day I get up and I think, "Ooh, maybe this morning, I will feel okay." And then I look at the weather report and I'm like, "Nope." Oh, and thank you, Velosa. I saw that. I definitely need to look at it. I do become a little, a little monotropic when I'm covering a heavy trial, but I definitely need to look at that. Our Lady Sarah Boone, she of Samsonite, is also defying the court for justice and the American way, I believe. I don't know. I so desire to give Sarah Boone the attention I need for the mockery she deserves. I just find myself without the bandwidth to even deal with, like, Sarah Boone level mockery, which is usually, like, my dessert. If I've had a hard day or a long trial, like, Sarah Boone mockery is kind of my happy place. But the fact that this trial has made me, just and it honestly hasn't been this trial. This year has been a lot of this year has been a decade, and it's only August. One in the chat if you feel me on that one. If 2026 has been a decade already and it's only August, I'm just saying. I am just saying. But this year has had Uvalde, which I did cover with Nick, but that was soul crushing. Then I went straight into the Canero trial, then the Athena Strand trial, and then this one. So this one has been, and the problem is, and I'm coming to realize that I don't always know my limits when it comes to this case because I always want to be a safe place to um, deal with uncomfortable trials, but I think there is a bandwidth of like 3 or 4 god awful trials in a year that I can tolerate. So and I think there is that intellectual knowledge that I know that trials are gonna be bad, but you don't recognize just how low the prosecution is willing to go, and I think in this trial, I was unaware how absolutely reprehensibly low the Commonwealth was willing to go, and that has been startling. That has legitimately been one of the most shocking things is the behavior, decorum, and just no hold barness this case has been treated with from the Commonwealth when what it needed was kid gloves and a gentle touch and to be here's the thing, had Steve Gosney had the Gosfather, had Steve Gosney brought this trial, I may not have agreed with all of his arguments, but I know I would have known down in my soul that it was being treated with not only compassion and mercy, but with an eye for justice that wasn't vindictive or malicious, but again, justice in the truest sense of what our our legal system was there to embody. You know, there has been a transgression on the social contract. There has been a loss. The psyche, the fabric of society, you know, the citizenry has been wounded by this. There needs to be atonement, but not without mercy, not without understanding the shades and the grays in between, and then, you know, tailoring justice to, you know, deal with that. I can honestly say that if Steve Gosney had brought this case, I would not be as worried. Uvalde showed restraint in comparison. I mean, they at least stopped when parents or told parents to leave the room when they went through what they went through with the medical examiners. This is ick. And again, I have said this as I have always said from the start of this trial. I honestly don't know what justice looks like in this case. I don't know if Lindsay should be charged with a lesser included crime of reckless homicide, but where do we put the onus on a person who might be in the middle of a psychotic break to warn people that they might be in the middle of a psychotic break when we have had 2 weeks of her basically warning everyone in a sundry that she is in the middle of a potential psychotic break. So I really don't know where the Commonwealth is going with this, and I feel like strategically none of it makes sense. They have burned out the jury's emotions, uh, multiple times, and they keep making stupid points that are quickly I don't expect this to be likely or even possible. I don't expect this judge to have the cojones to do this. But if any case would be eligible for the, oh gosh, what is it? Not the downward departure, but you know, the part in I am having a brain fart. Hagatha is being loud right now. The part where the defense comes up after the state rests their case and says basically, everything they said it amounts to nothing. If we were dealing with a judge with cojones, I don't know how you get past the hurdle of first degree premeditated red rum and what the Commonwealth has presented. Now, I understand their experts haven't gone on yet and everything else, but at right now at this point, if they were to rest their case, I don't know what they've proven to me as far as premeditation. I have no idea. I know that they would be quick to trot up there and let's see, point out where they think premeditation was proven. I'm just saying, I'm a pretty good observer, and I haven't seen anything that hasn't been immediately explained by either common sense or Reddington or a combination thereof. And that's the other thing. I understand the desire. Don't get me wrong. The desire to go out and defeat the monster that did this, the evil monster that is the reason that, these children aren't there. But unless you have a magical potion to, anthropomorphize, mental health illnesses, I don't know how you do that. I don't know, if Lindsay deserves to go to a mental hospital for the rest of her life or deserves a chance at freedom or what. I don't know that she'll ever achieve freedom in her head. Is her being locked in the guilt and reality of what happened punishment enough? I don't know. I don't know. But I do know that the justice system that I hoped was reflected, you know, every day wasn't a vindictive, malicious witch hunt of someone's worst moments. This isn't, I think, what the founding fathers had in mind when they, painstakingly put together our justice system. And it's not perfect. Hell, it's got some weird quirks and it's not the best. But to see it used thusly and so crassly, you want to talk about disrespect. This is disrespect for a judicial system that we tout as being one of the best in the world. This isn't something I would export to any country. What is being displayed here, I I, I don't even know. The state has to believe this plan involved months of working towards fooling everyone, including doctors. Everything's fine over here. I say 20 years in a mental facility, then let her come up for review. I mean, I'm open to anything because like I said, I don't know and I'm willing to hear all options. But they treated Tanner Horner with more respect and I'm not trying to be an ass, you guys. I don't want to open old wounds because I saw the transcript of what that man did to that little girl. And I could understand treating Tanner Horner like this. I could see reveling in causing him discomfort, but I don't get how this achieves anything to have Lindsay sobbing uncontrollably and all of this. Uh, Sebastian, you are probably asking yourself the same question we've all been asking ourselves for the last 13 business days, which is, why is this a case? Because I could understand making a case for reckless homicide, murder 2, crime of passion. Again, do I agree with it? Not really. But I do understand the need, the desire, the human desire to punish something, someone, anyone for this tragedy. But it just seems like the Commonwealth said, she's responsible. Come on, you're late, Commonwealth. You're New Englanders. The one thing you're supposed to do is be on time. Dang it. Now looking at X to make sure that there's not a delay, because if there's a delay, dear Lord. Ugh. And thus far, there's been no chatter on X as to why they're 2 minutes late, but it bothers me. They were supposed to come in on time. Now, I will be keeping an eye out tomorrow. There is a possibility. I know that there's going to be lawyerly things going on. So we might do a catch up on this weekend of, kind of a speed through if there were a bunch of legal maneuvers or motions that they do go over on Friday and that's televised. Uh, I'm wondering if they're possibly going to be convening for the day. Cause I'm getting bored of looking at the seal. I love that my face make the faces I make, as I'm just going through X, and it's my X algorithm needs, Jesus. All right. Thus far, we are just waiting for them to wake up and get the Commonwealth back and the jury at some point. Thank you, T42. Good luck and safe driving. I think it is going to back. I think it's going to backfire. According to some of the general look I was doing through Twitter yesterday. Yeah, and it is 2:05, but that's my time, but we are on Eastern time, so they should be here with us. This is why I start later. I do not like waiting for them to get back from breaks. It kills my focus. Uh, it lets me randomly tangent from subject to subject, and then I don't wanna go back to the trial. So, there is a method to my madness as to why I, uh, like to go a little bit or start a little bit later, to speed through these breaks. These are, uh, weaponized inattention, tactics, and they always get me. Yeah, we're just waiting. I do see this backfiring. I am not sure. I part of me thinks they're subdued today because they are aware of how hideous their case is going over. But the other part of me, um, questions why they would now show self-awareness when this entire trial they have been as self-aware as a jellyfish. And that's kind of insulting to the mental power that jellyfish do have, but they seem to have the self-awareness of a jellyfish. Okay, come on, Commonwealth. The ADHDers among us are bored. We are waiting for you to continue with your brand of stupid today. We really don't wanna, we're kind of being forced to do this anyway. Dun-dun-dun, dun-dun-dun, dun-dun-dun-dun. We have been waiting forever. I know to you it's only 7 minutes, but for me, it's been 30 years. Oh, okay. I just ran across this, so I am keeping an eye on the court to see when we will actually get back to the case because that would be helpful at any point, Commonwealth. But there is something, and look, take this validity with a dose of salt, but here is someone who is questioning the Lindsay Clancy trial, and let's see what they have to say. I legitimately haven't pre-screened this, so I don't know if I will agree, disagree, or um, shades of in between. But let's see. I'm digging the glasses.
This video is for Mr. Reddington and the Lindsay Clancy defense team. Mr. Reddington, I have several questions that I'm hoping that you can clarify through the remainder of this trial. Because when I lay Lindsay's treatment timeline out chronologically, I'm seeing a pattern that I don't think we yet have enough information to understand, and I think the implications could be serious. I'm Emily. Hi, I have a master's in counseling. I'm a former mental health clinician, and I have spent the last several years studying reproductive mental health. I also significantly struggled with a postpartum mental health illness and almost took my own life because of it. My first question is, do we know whether Lindsay's ovarian cycling had returned postpartum? At Lindsay's very first appointment with Dr. Tufts, she described anxiety about returning to work, about leaving her children. She was also transitioning Callan away from, possibly away from breastfeeding. And
Okay, and it reads, oh, good Lord, use different font in writing this. As ovarian function resumes, estrogen and progesterone begin to fluctuate again, and those hormones interact with the neurotransmitters involved in mood, anxiety, and sleep and stress response. Now, when I said that this particular look, I'm not dogging the medical industrial complex in that we are only at, say, the Industrial Revolution in our understanding of this beautifully complex organ, because not only is it sensitive to electrical stimulus, but it's sensitive to pathogens, it's sensitive to parasites, it's sensitive to hormones, it's sensitive to neurotransmitters. So it's incredibly complex. So I respect the complexity of this right here and wish that the medical community would be a little more honest that they don't understand it. But also I appreciate that there are interactions of hormones that we just haven't taken into account, both male and female, but more on the female side as it transacts or intersects with this case. JKD Buck, um, I'll tell you where your ovaries went later.
Bottle. Patrick also described her as saying it felt very unnatural to be leaving the children and heading back to work. So when did Lindsay reduce or stop breastfeeding? Was she exclusively breastfeeding, pumping, or combo feeding? Do her medical records tell us anything about the return of ovarian activity during this period? Did Lindsay report actually having a period, a bleed postpartum? If she did, do we have those dates? Is there a last menstrual period documented anywhere in her records? Do we see an LMP anywhere? It's important to note that I'm not only asking if her period had returned, because ovarian activity can resume before the first postpartum menstrual bleed. I also want to know whether Lindsay was taking hormonal birth control at any point postpartum. If so, what was she taking? When was it started? And when was it stopped? Or was it stopped at all? Because when I map Lindsay's psychiatric symptoms chronologically, I'm seeing an ebb and flow in her symptoms appearing approximately every.
All right, we are back in court. Where are we? Hush, I need to get you back on screen.
Court, all rise. Jurors enter.
Yeah, that'd be helpful.
This court's now in session. Please be seated.
Your Honor, for the purpose of the record, we return back to the trial of Commonwealth versus Lindsay Clancy. All parties are present, including the defendant and including the 18 jurors.
All right, thank you, Madam Clerk. Thank you, members of the jury. We're going to now return to the Commonwealth's presentation. Ms. Sprague?
Thank you, Your Honor. Commonwealth calls Joshua McGilligan.
Ooh, he's part 2 in Cletus the Trooper and him were the brainchild, the nexus, if you will, of the defense's. Oh, dear God, he does look like the type that would think. Now, let me explain to you the level of stupid to which the Commonwealth has decided that everyone operates. The Commonwealth has decided between these two, the trooper from yesterday and this particular trooper, came up with the idea that the psychiatrist that the defense sent in while Lindsay was in the hospital being guarded by said troopers with either a semi-closed door or a partially closed door or just a closed door, but them right outside said door, decided to say F it to his ethical obligations as a clinician, his moral obligations, his licensure, his ability to practice medicine ever again, and helps Lindsay cook up postpartum psychosis and auditory hallucinations so that she and Patrick and Reddington could basically fool all of us into believing that Lindsay Clancy had in fact postpartum psychosis. Yes, this is the level of stupid to which the Commonwealth has stooped. No, I wish I was joking with you. I can't make this level of stupid up.
Good afternoon, sir. Please stop right here. Wait right up to the clerk, please.
Good afternoon. Do you solemnly swear that the testimony and the evidence you shall give to the court and the jury will not fail to any Commonwealth. Thank you, sir. You may proceed.
Watch your step, please.
All right, good afternoon, sir. Jury Sprague.
Thank you, Your Honor. Good afternoon. Can you please state and spell your name for the record?
Joshua McKelligan, McKelligan.
Where do you work?
Why is Sam Eagle the human puppet on my screen? All I am seeing is Sam Eagle from the Muppets. Gentlemen, we must do our best. Like, This trial is trying to kill me. I am trying to be a professional. I am trying to be whew. And then what is this brow line? Dear God, what in the how does that even oh, that's an ear. Okay. Whew. This trial's trying to kill me. This trial is trying to kill me. Yesterday with the mic placement, today with damn Lurch. I can't get a win here. I'm telling you, our biomechanical overlords, if the Matrix gets any stupider, we are going to start waking up, okay? You might wanna fix the simulation. If it gets any dumber, majority of us are going to start involuntarily waking up. I don't think you want that. I don't think we want that. Please, just fix the Matrix, okay? Zion looks like a whole bunch of sweaty people that don't use deodorant, so I'm happy in the Matrix, but this simulation has gone full plaid. Just bring it back to ludicrous, okay? I can deal with ludicrous, but we've gone full plaid.
Massachusetts State Police
How long have you been with the state police?
since December 2013
In January of 2023, where were you assigned?
to the Plymouth County District Attorney's Office.
And what was your role there?
I was a trooper assigned to the homicide and major crime.
Oh my God. Stop with the lip smack. For the love of God, someone hydrate the entirety of Massachusetts. I can't with the lip smack. Has he ever looked happy? Is his face capable of portraying happiness, or does he suffer from Baker disease, where this is his range of facial movement? I'm a terrible person going straight to Hades.
Section.
And could you tell us within that unit what the role of a case officer is?
Case officer is assigned cases as they come in, and the case officer then is the point of contact for the district attorney's office, the state police, other agencies.
And as a case officer for a homicide, for example, when you respond to a scene and you're doing the investigation as time progresses, is the case officer doing every part of the investigation?
No.
What is the role of a case officer in terms of managing or collecting information?
Is to try to gather everything, and then we try to keep track of what's been going on with the investigation.
And so within the State Police Detective Unit at the Plymouth County DA's office, there are a group of troopers that work there, correct?
Yes.
And do you work as a team on any homicide investigations you're working on?
Yes.
And the case officer, is it their role to collect information and evidence from the other troopers as they gather it?
Yes.
Do you have a supervisor when you are the case officer?
Yes.
I want to direct your attention to January 24th, 2023. Did you learn that day of an incident that had happened at 47 Summer Street in Duxbury?
I did.
What time did you learn about that approximately?
About 6:45 p.m.
PM?
PM.
And how did you learn that information?
The duty lieutenant in the state police headquarters in Middleborough called me.
Once you had that information, what did you do?
I called my supervisor and then responded to Duxbury.
And where in Duxbury did you respond?
I went to Duxbury Police Station.
And at that point in time, did you know that you were going to be the case officer for this case?
Not when I responded, but at the police station, I was informed I was going to be.
And at some point in time, did you go to 47 Summer Street in Duxbury?
I did.
And when was that?
After I got a search warrant, I went to the house. It was probably, I think, around early morning, between 3 and 4, sometime like that.
Between 3 and 4 a.m.?
Yes.
So it'd be the early morning hours of January 25th, 2023?
Yes.
And did you take part in the search of the home?
I did not.
What was your role there at the home that night or in the early morning hours?
I just went to observe this, the house, just to see what the scene in the house looked like.
So other officers were conducting the search?
Yes.
At the scene, did you eventually walk through the house?
Yes.
And was that before or after the search was executed?
After the search.
At some point in time, did you go into the master bedroom on the second floor?
Yes.
And what did you observe in that room?
I remember a tent style, like covering a crib, I believe. There was a mirror in front of me. To the left, there was the bed. And then I remember blood on the floor.
And you said to the left, but pointed with your right arm?
No, it was my left hand.
Your left, okay.
Yes.
All right. So you go into the bedroom, and what do you see anything on the floor, on the walls, the bedding, anything?
Yes, just going off of memory, I remember there was blood on the floor, and the mirror was kind of like straight ahead from the entrance of the door.
Okay. And was a video taken of the house that included that room in particular?
Yes.
I'd like to move to submit the scene video from the home as the next exhibit.
Any objection? No. That may be admitted.
And if we could play the portion of the video for the master bedroom.
What are we doing here? Oh, for the love of Commonwealth. Ignore the background because Mr. Mo is still going to be doing construction. But y'all, this is hard. This is hard to watch. So ignore the gastrointestinal sounds. But if you guys need to take a break or walk away or anything, I have no idea where they're going with this. So just protect your mental health. And I'll be muting and not muting. Guys, I'm giving us a break. I can't. Something about the cup and everything.
I take it down. Woo! Yeah. Oh yeah. I take it down, minute and a half. Yeah. When the dark gets long and the tea is hot, and the emotions piled are quite a lot. When the state says boom and defense says pass, that's when I call my mini ass so classy and sass. Woo! Oh, Moxie, the emotional support mini donkey, tiny but mighty, a courtroom honky tonky. If the trial goes
Okay, rant incoming. You insufferable cunts. This is how you use emotional, strings effectively. Do you know the power you have in that freeze frame? That disturbing juxtaposition of because kids and then what your reality you're confronted with. If you had been subtle or smart in any way, you ham-fisted cunts, you would have understood the power that you had in that single frame, and you would have used it judiciously, but you couldn't. You just couldn't. And you know what? At this point, thank God you are less competent than Daryl Brooks at the way you're presenting this case. I just wouldn't call myself a lawyer of competence, but, you have bigger balls than I do.
January 25th, 2023.
Yes.
And then the third photo, please. We could zoom in on in there. Would this be, this third photo, would this be the first floor window below the master bedroom window?
Yes.
And these red brown stains on the shingles and then on the window ledge there. Were those there in the early morning hours of January 25th, 2023?
Yes.
Could we have these three photos marked as the next exhibit on the disc?
Any objection? They may be admitted.
Exhibit 265. Now, as the investigation proceeded, did you learn, or did other officers learn from Patrick Clancy that the defendant was on some psychiatric medication?
Yes.
And was that information relayed to you in terms of preparing the search warrant?
Yes.
And is that why you included prescription medication in the search warrant?
Yes.
At that point in time, did you or any of the other officers know that the defendant had crushed up pills and taken them that night?
No.
At some point in time, did Patrick Clancy bring pill bottles to the state police and turn them over?
Yes, he did.
And where did he say those were from?
In the center console of his truck, not the top section, the section underneath it.
Did he tell you at some point that pills had been found in the nightstand drawer?
Yes, he did.
And that was in the master bedroom?
Yes.
And did he tell you who he found those with?
Yes, he did.
And who was that?
His attorney.
And did he tell you why he gave those pills?
Objection, I believe it was me, and I'm not his attorney.
But that's what, why don't you re-ask that, what it was that Patrick Clancy said?
What was it that Patrick Clancy said? Did he give you a name or just say my attorney?
He said Kevin Reddington.
And did he tell you why he gave the pills to Attorney Reddington instead of giving them to you like he gave the other pills?
No, he did not.
Are you going to explain how all of your cadre of highly trained, specialized trooperologists managed to miss the pills cleverly hidden in the nightstand? I know Lindsay went through the extra step, the evil mastermind plan of shutting the nightstand and hiding it from obvious view. And had these detectives ever rolled anything higher than a 1 at perception, they might have caught it. But they had a cloak of stupidity upon them and were too dumb to realize it. This is your best Commonwealth?
He never attempted to turn those pills into the state police or those bottles into the state police. Is that correct?
Correct.
At some point in time, did you learn that the Clancy family had gone to the Museum of Science on January 8th, 2023?
Yes.
And was a video obtained?
Yes.
Did you watch that video?
Yes.
Did you observe the family, including the defendant, interacting with each other and the defendant specifically interacting with the children and exhibits at the museum?
Yes.
Your Honor, at this point in time, Exhibit 14.
Also, good Lord. Objection from the court of public opinion, the weird side. Daggone it, I think he plans this. Um, I can do things like be social at Dollywood. It does put me down for roughly 2 weeks. So, I am aware of what it's going to cost me, and I love hanging out at Dollywood, so don't misinterpretate that. But I will be emotionally drained for at least 2 or 3 weeks from all the peopling. It's not a good or bad thing, it's just how I am. But I am able to do it.
I'd asked to play just a small portion of that. It has not been played previously.
I'm sorry, guys. The Commonwealth, like I said, can run their case however they want, but what we won't be doing is watching happy moments of these precious children with the intent to emotionally hurt the defendant. Again, regardless of your feelings on the defendant, I find that cruel and unusual, and I do not allow it. Over here on the, wonky side of the court of public opinion. Also, do be aware, you guys, if the sub count goes down, or the viewer count or whatever you call it goes down, protect yourself. We're probably going to hear Lindsay crying. This seems to be the most pleasurable experience in the Commonwealth's life. But it is gut destroying. It is soul destroying. So do be mindful. Protect yourself. I can do puppy kitten breaks, but you guys, I never want to view in over your mental health. So do please be mindful. You guys know that I will, if you guys ask, if you guys have to, drop out, if you guys come back on Monday and you say, hey, what happened here? I will give you guys a brief synopsis of what happened, and you guys won't be missing anything effectively. But I just be mindful. This is going to suck all the donkey, as delicately as I can put it.
Sir, during the grand jury process, did you attend a meeting with the medical examiner in this case?
Yes.
And did you participate in interviewing her, specifically Dr. Barbara Vidal Olson?
Yes.
And did you participate in interviewing her, specifically the portion of her proposed testimony where she was explaining how someone dies from strangulation?
Yes.
And would it be fair?
We're going directly to Reddington, stopping this shit. Let's see here. Mr. Moe.
Sir, in that meeting with the medical
Again, this judge is treading on thin ice. He was recently overturned because in a very similar case to this, he let the Commonwealth basically do this same kind of trial presentation, and that was just found by the Supreme Court to have been cumulative and prejudicial. So he just got dinged, and you would think that he would adjust his judicial take, but no. If this is the course of this testimony, what we might do, because I am honestly getting a little tired, and I am trying to learn to listen to those signals, and I'm not the best listener, so I'm probably a bit overtired right now. The joys of learning how to listen to the subtle signs of my own body. Oh, okay. Alrighty. I like the I like the cloak. Ooh. I could do my own 80s rock music. Okay, anywho, focus, Mo. you're almost done. Um, I feel like I need the cloak back. Again, the weirdest things make me comfortable, but there you go. Um, what I will probably do is just speed through this on my own, and then if you guys have any questions or if there's anything pertinent, we might watch it on Monday. But honestly, I am not in the mood again to be a witness, a voyeur to emotional waterboarding. It's a bold strategy, and I just don't know where we're going with it, and I don't wanna be party to it. I do have you guys, redirected. There's going to be a squirrel school, and if there isn't anything more miraculous and life affirming than watching the expert learn and Emily C. sometimes curse, like, those things are the most awesome things together, watching Emily C. trying to keep expert on track. And then sometimes cursing and then doing this thing. She, like, resets teacher mode, but she was like, "But I will use the F word again." That has been the most entertaining clip. Emily C, I am not encouraging you to curse only for my benefit. I'm just saying the world is in need of healing, and it seems to be healed by you doing, the cursing. I figured we needed something a little less heavy, but all in the search of justice is one of the great ways that we can kind of zone out, have fun on the YouTube streets, and still get a little bit of knowledge in our heads, or just watch expert learn, which is amazing to me. Not like in that I didn't think he could learn. I don't mean it in a sarcastic, talk down way, but just the way he learns and intakes information is so incredibly fascinating to me, because just when you think he isn't getting it at all, he will say a sentence that shows that he has, understood the entire, like, thing from beginning to end, while appearing to not be paying attention at all. It's the most miraculous thing. I love it. It's cool to me. So look, you can nerd out on expert learning or just Emily C potentially cussing, but check it out. He is an awesome creator, and so is Emily C. And in a world full of butt monkeys and oh, for goodness sake, trauma vultures, let's hang out and build up people like Emily C. and expert. I will see you guys tomorrow. Uh, have a great day.